Good morning, folks who might be listening from other parts of the state. It's Senate Chair Kathy Breen. We are going to start our appropriations meeting shortly. We are waiting for a 7th committee member to get into the building so that we have a quorum so we can start the meeting, and then we will take a brief break after we start the meeting to let those members scatter to other parts of the State House. So please stand by. Sorry for the delay. So good morning again, folks. You all set? Okay, thank you. Good morning.
Good morning.
We are here at appropriations today, and I'd like to ask folks who are here in the building to introduce themselves. We'll start with Representative Martin, please.
Madam Chair, John Martin, House District 151, and I represent from Allagash to Fort Kent, down Route 11 to Oxbow.
Hello, my name is Eric Jorgensen. I'm really sorry I'm late. I represent Portland.
Good morning, Teresa Purse, House District 44, the majority of Falmouth.
Good morning. I'm Solon Millet, representing House District 71, towns of Norway, Sweden, Waterford, and West Paris.
Good morning, Linda Sanborn, Senate District 30, which is Gorham, Scarborough, and Buxton.
Good morning, everybody. I'm State Representative Drew Gatine. I'm the House Chair of the committee, and I represent part of the city of Westbrook.
And again, I am Kathy Breen. I represent 6.5 communities in Cumberland County, and I'm the Senate Chair of Appropriations. We decided to have me do the technical hosting today. And this is a first for me, so please exercise your best patience and sense of humor as I learn to navigate this. My co-chair, Representative Gatine, did it for the last 2 meetings, and I figured it was time we shared those duties. And I think before we have folks scatter to their various rooms, Representative Gatine wants to make a couple comments about today.
Madam Chair, again, I just want to point out, I don't think the members who are not in the room have had the
Thank
chance
you.
to introduce themselves yet.
Thank you, Mr. Co-Chair. I really appreciate that. So there are members who are not in the room today of our committee who need to introduce themselves. So I will call on Representative Keschel.
Yes, this is Dennis Keschel. And I represent 76. That includes Belgrade, Fayette, Mount Vernon, Rome, and Vienna, and Wayne.
Thank you. Representative Hubble.
Good morning, everybody. Brian Hubble, representing House District 135, Bar Harbor, Mount Cert, Lemoyne.
Thank you. Representative Arata.
Good morning. My name is Amy Arata, and I represent District 65, which includes New Gloucester and part of.
And Senator Hamper.
And Jim Hamper, Senate District 19, 13 towns in Western Maine, joining you from the west shore of Thompson.
We cannot hear you, Senator Hamper.
Shore. Can you hear me? Thompson. Okay, good. Can you hear me?
Yes. Now we cannot hear you. I think you're still muted, Jim.
Okay.
There.
Better? Yes. Senator Jim Hamper. Okay. Better? Senator Jim Hamper. Can you hear me now? Better? Construction equipment in the back. Can you hear me now?
Yes.
Construction equipment in the back. Yep. Jim Hamper, Senate District 19, 13 towns, yep. Western Maine. Jim Hamper, Senate District 19, 13 towns, Western Maine. Sitting on the west shore of Thompson Lake. Sitting on the west shore of Thompson Lake.
Thank you, Senator Hamper. So I believe everybody has introduced themselves. Thank you. Oh, one more. And that is Representative Dunphy. Thank you.
Oh, good morning. Michelle Dunphy. I represent House District 122, which is Old Town. Good morning. Michelle Dunphy. I represent House District 122, which is Old Town and the Indian Island voting district.
Thank you, Representative Dunphy. All right. We have introduced the committee. Thank you. So Representative Gatine is going to give a few words about our day today, and then we're going to have folks their various rooms in the State House.
Great. Thank you, Madam Chair. Again, grateful for the committee to gather again under, again, these still somewhat unusual circumstances. I think that every time we've met, the technology available to us has changed a little bit. So again, I continue to be appreciative of that work. And, you know, it always adds a little bit of a different flavor, but I'm sure things look like they're working well today. So again, our agenda today, again, has a couple large items on it. First, we're going to get an update from the administration on May revenues, which I think we just got the report yesterday afternoon. Obviously, we're going to focus a lot on what the impact is of the COVID crisis on our revenue situation. Continue to talk about how we move forward, in particular with proposed uses of the CARES Act money and how we stage ourselves to be successful as we move forward into the next fiscal year, which will undoubtedly we will face a lot of challenges. Then we're going to hear, similar to what we did a couple of weeks ago, from a number of invited participants who, again, are going to talk with us about how the COVID crisis has impacted their operations, how they've tried to respond to that, and you know how they think they can partner with state government going forward to make sure that they land on firm footing as we move through this crisis. A couple weeks ago, I think, you know, to characterize it, I think we heard from a lot of, you know, sort of Main Street type businesses, you know, a restaurant, a hotel, a small manufacturers, some agricultural interests and others. I think today, if you look at our agenda, we're going to hear from a number of people who interact on the healthcare side and social services side, primarily not-for-profits, but again, not all of those businesses are not-for-profits, and I think they've had some very unique challenges that they've faced, and I'm very interested in hearing what we're going to hear today. The only other thing I wanted to, well, two really brief things I want to mention is want to acknowledge that today is a state holiday. It is Juneteenth, a very important day in American history, which marks the moment when the emancipation was finally proclaimed after the end of the Civil War, over 2 years after the Emancipation Proclamation was actually signed. This is a state holiday, so again, I appreciate people being available today on a state holiday. And again, I think it's an important reminder of our American history, both something to be celebrated and something to remind us of a lot of work we have ahead of us. As we move forward in this committee, I do want us to be mindful as we talk about moving forward, acknowledge again the disparate impact that this crisis has had on lots of communities in this state, but in particular communities of color. And I think as we talk about economic recovery, we need to keep that in mind and try to understand why that is the case and how we can assure that the economic recovery reaches all communities within the state. So I'm hoping we're going to continue to keep that in mind and ask questions around that as we move forward. The only one other thing I wanted to also mention, again, is acknowledge the tragic, really, passing of former Speaker John Richardson this week. I think that was a shock to all of us. I know there are members of this committee who served with former Speaker Richardson, and again, just want to send our condolences to his family as they go through these difficult times, and just keep him in our thoughts today. So thank you, Madam Chair.
Thank you, Representative Guttine. And I would just add on to that by assuring folks that if you have not been invited to come and talk to the Appropriations Committee, that doesn't mean you're not going to have a bite at whatever apple that we're going to be eventually talking about. We obviously didn't have the entire universe of businesses. We don't have the entire universe of healthcare providers. We are very deliberately trying to pick individual entities because the administration is doing a good job working largely with trade organizations and state associations. So we have deliberately tried to complement that with individual type of entities with, you know, kind of boots on the ground. And, you know, we have already heard from folks who were not able to get on today's agenda. And my co-chair and I are absolutely available and willing if folks want to set up meetings with us and discuss their experience with the pandemic, their perspective on CARES Act funding and any and everything related to the pandemic, including that the Permanent Commission on Racial Equity just submitted a report and a letter to the governor with respect to the disproportionate impact of the pandemic on Mainers of color. So our committee meetings are not the universe. They are a sampling of the universe, and my co-chair and I remain very interested and eager to talk with any entity around the state. So please keep that in mind. And with that, I think we will take a couple minutes before we hear from the DAFS commissioner to have our members here in the committee room take a few minutes to get to the other committee rooms where they will be unmasking and participating on their computers. So 2 to 5 minute break. Okay, everyone, we are ready to get going with the first part of our agenda. So we're going to hear first from Commissioner Figueroa and several other members of the administration, including Mike Allen and Hannah Pingree. And I'm sure Commissioner Figueroa will be teeing up their remarks as she goes along.
Good morning. Can you hear me okay? Good morning. Can you hear me okay? I've got a wicked echo. I've got a wicked echo. Better? Better?
Can you speak again?
Yes, I can. I hear everything I say twice. Yes, I can. I hear everything I say twice.
We will, first I'd like to, well, we'll try to get our IT people down to help with that. One moment, please.
Senator Breen, I wonder if the committee room might need to be muted. Senator Breen, the committee room might need to be muted in that.
We are, but we also have an extra laptop in here to control the movie screen. So, Hannah, can you say a couple more things and see if you're still getting the echo?
I'm testing your system. I'm testing your system. Ah,
Are you still getting the echo?
yes. It's about
It's delayed.
3 seconds after
Yes.
everything we say.
About
Delayed.
3 seconds after everything we say.
Yeah, we're getting the delay, but we're not getting the echo. So hang on, we're still working on it. Commissioner, you want to try one more time?
Good morning. Good morning. Still getting it twice. Still getting it twice.
Senator Breen, I don't believe there was an echo on
Well,
our
still
intros.
working on it.
Senator Breen, I don't believe there was an echo on our intros.
There was when Senator
I don't think
Hamper
people
came
in the
on.
building are getting it. It's the
There
remote.
was when Senator Hamper came on.
Still working on it. Thank you for your patience.
Perhaps Senator Breen should be the one that mutes and unmutes. Perhaps Senator Breen should be the one that mutes and unmutes.
Did you say try again? Did you say try again?
Sorry, what'd you say, Commissioner?
I thought you had said try again. It does seem like, I thought you had said try again. It does seem like that meeting audio video control box is the one that might be causing trouble.
Commissioner, can you try again, please?
Good morning. All right. Oh. All right. Oh. I think the delay got longer. Somebody's telling the delay got longer. Somebody's saying that maybe we have the audio gain too high. I have no idea what that means. Have the audio gain too high. I have no idea what that means.
Can you try again, please, Commissioner?
Good morning. Good morning. Well, I heard it that time, but I heard it softer. Well, I heard it that time, but I heard it softer. And quicker. And quicker. Maybe not. Maybe not. So weird. So weird.
Going to see if it happens from other video participants. Going to see if it happens from other video participants.
Am I doing the echo?
No.
You apparently only have one Keschel and two Hubbles.
Am I echoing?
You are.
No. Have we fixed it?
Commissioner, can you try again, please?
Yes, good morning. How is everybody today?
So far, it's been an interesting morning. How is your echo? Are you getting an echo?
I am not getting an echo right now. Hannah, do you want to try?
I am testing again. Don't hear it.
I think
Fixed.
we're good. Okay.
Okay, I think we still have a delay on our end, but you don't have an echo, so we should probably proceed and see what we can do about the delay as we go along. So,
okay.
Thank you everybody for hanging in there, and Commissioner Figueroa, take it away.
Take 10. Good morning. We are starting a little bit later, but the original intent was that Dr. Allen would talk first about the latest revenue report. I would then do a part of the agenda around the CARES Act funding reporting and updates. And Hannah Pingree is here to talk about the Economic Recovery Committee, structured general information. And then back to me for just a quick wrap up. And I'm wondering if you'd like questions in between those sections. Would you rather wait and have them at the end, whatever your preference?
I think I'm going to make an executive decision and ask folks to wait till the end.
Okay, so
I would suggest folks that you write down your questions on a note paper or something so that we can do a round at the end.
Okay, with no further ado, I'm going to hand the mic off to Dr. Allen.
Thank you. Good morning, everyone. I'm going to try to get through this as quickly as possible because I know you have a busy schedule. You have the Commissioner's May revenue report in front of you. And I would just like to point out that at the start of the report, you can see that we did not accrue any revenues in May. The next time that we will accrue some revenues will be this month, because the second estimated payment for the calendar year for individuals and corporate calendar year filers was due on June 15th, but as you know, it's been deferred at both the federal and state levels until July 15th. What I'm going to try to do is for brevity, but I think the areas that are of most interest at this point and that we're watching most carefully are sales tax and withholding. Those are the two revenue lines that provide the most information about what is going on in the economy now in real time. They are the two biggest sources of revenue to the general fund as well. But I think the interesting thing about the sales tax data that we're getting and the withholding data is in some ways they're very inconsistent with one another. Usually they move in tandem, and normally they provide a fairly consistent story of what's going on in the economy and in households in the state. They're really providing two different directions of how the economy is going right now. And that is consistent with a lot of the national data that we're seeing. So I want to talk a little bit about that and maybe lay the groundwork for the Consensus Economic Forecasting Committee meetings next week, and then the Revenue Forecasting Committee meeting that will take place at the end of July, because the data that we're seeing and the inconsistency in it and the confusion that it's providing to us is going to create a challenge for both of the forecasting committees. So let me start with withholding, because I think that sets up a little bit of as to what we're seeing on the sales tax line and why we're seeing what we're seeing on the sales tax line. So withholding in May was under budget by 3.3 million, but I think the most important factor on the withholding is that we're over budget year to date by $2.5 million. And there's been a lot of timing issues over the last few months to go along with the pandemic having an effect on withholding. But in our view, it's really stayed on course. We're about $2.5 million over budget year to date. And based on what I'm seeing so far this month in June, I would expect that we will be very close to budget on withholding in June as well. So we should end the fiscal year consistent with on withholding with the March forecast, which was done prior to the COVID crisis occurring. If that's the case, then we will end up seeing year-over-year growth for the fiscal year of 5.5% on withholding. That's very good. That's pretty much what we saw last fiscal year. And that's extremely strong growth. Now, the reason why it's holding up, we think, and we have information from our colleagues in other states that support this, is that the expanded unemployment insurance benefits that Maine workers are receiving are definitely playing a role in why our withholding has not been reduced or decline to the extent you would think when you're seeing an unemployment rate that is roughly 10% here in the state of Maine. Maine, like many other income tax states and the federal government, taxes unemployment benefits. And so, we do get some withholding on those unemployment benefits. We're seeing historic levels of withholding on unemployment benefits. And the reason for that, we believe, is the additional $600 benefit that the federal government has provided through the CARES Act. And that is scheduled to end at the end of July. So that's an important factor, and it's going to be an important factor next week when the Consensus Economic Forecasting Committee meets, because the primary economic variable that they provide to the Revenue Forecasting Committee is personal income growth. And unemployment insurance is a component of personal income. And normally it's a very small component, and it's not an area that the Economic Forecasting Committee usually spends a lot of time on. But this time around, they are going to have to spend a lot of time on it because they're going to have to understand the magnitude of the unemployment benefits that are now going out to Maine households and are subject to state taxation, and the consequences if those additional benefits were to end at the end of July, as they're currently scheduled to. And we've been in contact with our partners at the Department of Labor, and they're helping to provide us with some detailed information that not only can the Economic Forecasting Committee use next week, but the Revenue Forecasting Committee will utilize when we meet at the end of July. But one of the interesting facts that we've noticed from talking to our colleagues in other states is most states tax unemployment benefits. Some states don't tax unemployment benefits. And in those states that don't tax unemployment benefits, you're seeing their withholding decline consistent with a severe recession and rising unemployment rates. In those states that do tax unemployment benefits like Maine, you're seeing withholding hold steady and even grow a little bit at a time when unemployment rates are spiking and the economy is in a severe recession. So that's why we think it is important and why it's important to get an understanding of what's going to happen going forward for the two economic and revenue forecasts. So that's the story on withholding. Now, withholding is doing well. It's holding up. Normally, when you see 5.5% growth in withholding, you would think that's going to lead to fairly strong sales tax growth. If people have income coming in, they're probably out there spending it. But in the current situation we're in, that is not the case. And you can see from the controller's report that in the month of May, sales tax receipts were under budget by 26.4 million. That's a variance of 22%. And for the year, sales tax receipts are under budget by 43.3 million. That's a variance for the fiscal year of just under 3%. And if you go down the right-hand side of Exhibit 1 of the controller's report, you can see the negative variance for the general fund matches up with essentially the negative variance on the sales tax line. So at the moment, it's the sales tax line that's driving the revenue problems that we're having in the general fund. On Exhibit 2 of the controller's report, you'll see that in May, compared to last May, sales tax receipts were down 16.1%. That's one of the worst months that I can remember in the 23 years I've been here. I've never seen it that bad. And the taxable sales report that's also included with the commissioner's report, you'll see the taxable sales in the month of April, May revenues, April sales, was down 13%. And the reason for that slight difference between the decline in taxable sales and the decline in revenues is that you can see from the taxable sales report the huge declines in restaurant sales and lodging sales. And of course, they get taxed at a higher rate than other products that are taxed under the 5.5% general sales tax rate. So prepared foods are taxed at 8%, lodging is taxed at 9%. So they have an oversized, they outweigh the general sales tax rate of 5.5%. And that's why the revenues fell by 3 percentage points more than the taxable sales. Now, when you dig into the data a little bit, it gets a little interesting, and it all revolves around prepared food. So for instance, when you look at the taxable sales report and you look at food store sales, you can see that they're down 4.4% year over year in April. But when you look at just the 5.5% component of food store sales. They were up 13%, which is consistent with what we've all seen when we go to the supermarket, right? People are stocking up on cleaning supplies and paper towels and toilet paper and those types of products that are taxable at the food store, and they're taxable at 5.5%. Well, if food store sales are up 13%, then why is it showing 4.4% on the taxable sales report? That's because supermarkets also sell prepared foods. And what we're seeing is that prepared foods fell by 55%. Many stores, especially in the early part of the crisis, weren't selling prepared foods. They weren't offering that to their consumers. Some of that has come back now in the last month or so, but that part of their sales really took a hit in the early stages of the pandemic. We see the same thing in other retail. When we just focus on the 5.5% portion of the other retail sector, that was up 53.7%. But again, you can see on the taxable sales report that's attached to the commissioner's report, it was up, still a robust 43.8%, but not as much as when we just focus in on the 5.5% component. Again, some of these other retail sector stores sell some food products, some prepared food products at 8%. And, again, that area in general saw a 55% decline year over year in the month of April. So you can really see some shifting in shopping patterns and what's being offered to consumers when you dig into this data a little bit. And that's all consistent with what we're seeing nationally. Getting kind of to the confusing nature of the data that we're seeing. So we have double-digit unemployment rate nationally, and I believe this morning the state unemployment rate came out, it was 9.3%, so it was down. I think it was 10.6% in April. So we're averaging about 10% unemployment rate at the moment. Withholding is continuing to be on budget and growing at a very good rate. We have stimulus dollars coming into the state in various ways from the federal government. There were the stimulus checks that went out in April. There's the PPP. There's the additional unemployment insurance benefits. All that coming into the state. We had estimated from the stimulus checks alone, that was over $1 billion that came into the state of Maine in a 3 to 4 week period beginning in the middle of April. That's a significant amount of stimulus to the state. And yet we see consumer spending down. And if you look at the national data for April, the Bureau of Economic Analysis had reported in the month of April, real disposable income increased almost 14% year over year. Normally, if it were to go up about 3% year over year, that would be considered a good, solid month. This was an historic jump of 14%. So people had a significant amount of resource available to them in the month of April. Again, a lot of it from this federal stimulus package. Yet, when you look at real personal consumption expenditures, they fell by 17.3% year over year. So people had an increase in their disposable income by 14%, and their spending went down year over year by 17%. They had no place to spend it. They had all this resource, but they were sheltering at home. Many businesses were closed. It's clear from the data that people were able to make some purchases online and have it delivered to their homes, but people's consumption significantly fell in the month of April. And when you kind of combine those two data points, people's income rising so much and their consumption falling so much, that means they saved a good chunk of that income that they received in April. The savings rate nationally in the month of April was 33%. It has been running for about the last year or so at 8%. So that's an incredible statistic, 33% savings rate for the month of April. So again, this is this is not a normal recession by any stretch, where we're seeing incomes hold up, and in fact, disposable income rise by historic levels. And usually in a recession, you see incomes decline and you see spending decline, but usually spending stays fairly constant, right? You need to eat, you need to clothe yourself, you need to get gas. Spending is usually less volatile than income. We're seeing the direct opposite in the current recession that we're in, to the extremes. The other piece of information that came out earlier this week, and there was a New York Times article on it that one of my colleagues and DAFs passed around, and we were discussing it extensively over the last couple of days because it's just very interesting information, and again, just flies in the face of what one would expect in a normal recession, even a normal severe recession. And that's it's called Economic Tracker. It's a consortium of folks from Harvard, Brown, and the Bill and Melinda Gates Foundation. And they've been tracking credit card transactions and linking those credit card transactions back to the zip code of the household that is using those credit cards, and looking at how people's purchasing has changed since the start of the calendar year. So it's looking at data starting around mid-January and looking at that data through, I think it was June 10th, middle part of this month. And what they found is that the group who's seeing their consumption decline the most is the top 25% of the income distribution. That's the group that has seen their consumption drop the most. Again, completely flies in the face of what one would normally think, right? Upper income people, their income for the most part haven't been affected all that much. They have savings and other resources available to them, but their usual consumption patterns, going out to eat, going to a theater to see a play or a concert, services that they usually consume have all been shut down, and particularly in the month of April, as opposed to lower income households that certainly saw their consumption decline, but not nearly as much as the upper end of the income distribution. And the other interesting fact of that website, and I'm happy to provide it to Maureen, so you folks can go take a look at it. It's very interesting, is that you can focus in on each state. So if you take that website and you look at Maine, and you look at all consumer spending between the middle of January to the middle of June, the growth in consumer spending was basically flat. We saw in Maine, we saw no growth. Whatever was the spending was on at the end of January, that was exactly the amount of spending that occurred in the middle of June. There was no growth between that period. But then if you break it down into the three income categories, low income, middle income, and high income consumption was down 6% over that period. Middle income was flat, and low income was up 4%. Again, not the usual pattern you would expect to see in a recession as severe as this, and a recession that has affected the lower end of the income distribution as far as the loss of jobs like this particular recession has. And again, it's all revolving around the consumption patterns of these different groups. And the service sector has been particularly hard hit in this recession. And it's high income households that typically are purchasing these services, and they weren't able to purchase them because the facilities were closed. So it's very difficult to reconcile the data that's coming in and to interpret what this means and what this means going forward as the economy begins to reopen. Some of these stimulus programs at the federal level now at least are scheduled to start ending. And that's going to be the challenge that the two forecasting committees have over the course of the next month, is to try to understand what all this means, all this data means, and more importantly, what it means for the next year or two. I think the only advantage that we have at this point is the schedule. Again, I think we made the right decision in not going out and doing a forecast immediately after we did our March forecast. I think the fact that we've waited to see the data has been to our benefit. Many states that did go out and do a forecast in April and May are now walking them back. They're finding out that things haven't been as bad as they expected. We're going to have a
Dr.
new
Allen?
economic and revenue forecast by August 1st. So that will provide the governor, the legislature, you folks with current thinking. The two committees will meet together for our retreats probably sometime in late September. So once this current process is complete, about a month and a half after that, the two committees will come together to not only review the stress test report, but I think at that point, it'll be an opportunity for us to look at how are the two forecasts unfolding. Are they going the way we thought, or are we going to need to make adjustments? And then probably a month after that, the Economic Forecasting Committee will be coming in at the end of October because they have a November 1st report date to the
Okay.
legislature and the governor. So
Dr. Allen, I'm gonna, if you don't mind, thank you, and ask you to wrap up if you could.
Yep, that is my wrap up. That I think we've got this lined up to have information available to the administration and to the legislature as you prepare for the biennial budget.
Thank you. And just to remind folks that everything that Dr. Allen is describing is the economic activity that took place in the month of April and ended in April. And that was the month where the most businesses were closed, the highest number of places were closed. There was the least amount of economic activity that we had during this stretch. So this report pertains to economic activity in the month of April. And in the month of May, we slowly started to reopen some things. So we'll be hearing more about that in our next update. So thank you, Dr. Allen. Is Hannah Pingree, are you next?
Commissioner, you want me to go next, or do you want to talk about the FEMA stuff first? You're on mute.
It's okay for you to go now, Hannah. Thanks.
Okay, great. I will try to keep it brief, but happy to answer questions. I believe that Maureen had distributed just a quick fact sheet about the Governor's Economic Recovery Committee and the membership. It's also online at maine.gov/future/ if you go to the maine.gov/future and click on economic, you can find information on the committee easily. So Chairwoman Breen, Chairman Gatine, members of the Appropriations Committee, my name is Hannah Pingree. I'm Director of the Governor's Office of Policy, Innovation, and the Future. And I'm here just to give you a quick update on the status and sort of the details of the Governor's Economic Recovery Committee. I think it has relevance for this committee's work over the summer, and hopefully will be helpful to you all. So just the quick details: the governor established the committee by executive order on May 6th. The committee includes 40 leaders that represent a broad range of industry, nonprofits, and education sectors, economists, folks involved in workforce development, as well as state, local, and federal and tribal leaders. I think it does include 4 members of the legislature, including your own Representative Brian Hubble. We have 1 member appointed by each of the legislative leaders and caucuses, and we have 4 designees for the 4 members of the congressional delegation. The group is co-chaired by Josh Broder, who is the CEO of Tilson, a Portland technology company, and Lori LaChance, the head of Thomas College and former state economist, who I'm sure many on this committee know and remember well. So the major challenge of the group is to advise the state and the governor on economic recovery for Maine, while the frontline response to COVID-19 is ongoing. The restarting plan is outside of its purview, and the committee does not have public health expertise. So the charge that Governor Mills gave this committee was really to bring an on-the-ground business sector-wide experience of what is happening in this economic crisis, and what is the advice that that group has for her and this legislature on how to get the state back on track. The sense was also that folks like Commissioner Figueroa, Commissioner Johnson, Commissioner Laura Fortman were really in the depths of dealing with day-to-day challenges of the COVID-19 crisis. And we really needed a group with both outside expertise and bandwidth to help provide advice. So the committee charge is in two parts. The first one is that by July 15th, the governor is looking for a series of support and stabilization recommendations for the governor. So clearly, we all know that business sectors across our state, as well as sectors like healthcare, childcare, education, are in a significant period of challenge. So the idea is to provide those ideas, whether they are policy ideas, funding ideas, regulation items that will allow us to stabilize these business sectors. And then the longer term is to provide recommendations by December 1 that provide a bridge to the state's 10-year economic plan released last year. So as the world has changed, the governor has launched this group with a charge to really consider those places where the state can innovate and reimagine and get back to the economic plan. So whether it's figuring out broadband solutions or supporting innovations and transitions in our economy, like how do we provide more local supply chains for food or PPE, the pandemic has really illuminated a lot of those places where the state needs to focus. So since the committee first convened on May 15th, they've had detailed briefings from Commissioner Johnson, who really provided an update on the restart plan, as well as a roadmap of the 10-year economic plan. We've heard from Dr. Shaw on the CDC's work. We've heard on the federal programs from the SBA. We've heard from the state economists, from the Department of Labor, their Center for Workforce Research and Innovation, of information on some of the layoffs and unemployment information that I know this committee is also interested in. And just this morning, the committee heard presentations from the Boston Fed and the Department of Health and Human Services on the labor and workforce research and how we really support frontline workers and the impacts to people across our state. So the committee meets every week on Fridays from 8 to 9 a.m. The meetings are all public on webinar formats, much like this one. We've seen wide participation and interest from folks in Maine. And the committee is doing a lot of its heavy lifting in subcommittees. And those committee meetings are also in a public Zoom format. Their information is posted online about their materials and agendas. So the subcommittees are grouped around the sectors of the economy. The first one is hospitality, tourism, and retail, chaired by Bob Montgomery Rice, the president and CEO of Bangor Savings Bank. The next is manufacturing and natural resources, chaired by Larry Shaw of MMG Insurance. We have an innovation group chaired by Betsy Beeman, CEO of Coastal Enterprises. An infrastructure group chaired by Susan Corbett, founder and director of the National Digital Equity Center and former director of Axiom Technologies. We have a healthcare nonprofit childcare and social services group chaired by Bill Burke, the chairman of Maine Health, and also manager of the Portland Sea Dogs. And lastly, we have an education and workforce group chaired by James Herbert, the president of the UNE. So again, the group's challenge is to try to provide a bridge to the 10-year economic plan. And I think as maybe Commissioner Figueroa even said, this is really in the swirl of the COVID-19 impacts. We're clearly in an incredibly tumultuous economic period. And so trying to figure out that bridge is a challenge. The July 15th report will be about highlighting the impacts and the urgent areas of concerns of the pandemic to the various sectors and how we might provide relief and support to these sectors, the support they might need to survive. So just a couple more of the challenges. Again, drilling down on specific recommendations during a period of fast-moving economic recovery is a challenge. While the group has really tried hard to not focus on reopening, seeing past the larger issues at play are challenging, especially in an area like hospitality, tourism, and retail, which is obviously sort of on the front of many people's minds these days. We are trying hard to ensure broad perspectives are heard in a short time frame. The committee includes people who are deeply involved, who own businesses. They are all, like many of you, getting many emails from friends and constituents and fellow business owners and sector leaders. And they are also trying to make recommendations in a funding environment in which stimulus priorities from the federal government still remain unclear and state funds are limited, but there certainly is urgency. There have been a couple lessons already learned to date, and I'll just quickly go over a few of those. Many I'm sure are obvious to this committee. But much like COVID-19 itself, the economic disruption is hitting the most vulnerable businesses and people the hardest, the smallest businesses, the seasonal businesses, and the most vulnerable communities and workers, restaurant workers, seasonal workers, healthcare and childcare workers, those who can't transition telework to telework, and frontline workers who are in sectors that are much reduced. The disruption is across the board, but seasonal tourism and public-facing businesses and services are the most challenged. And the early federal stimulus through PPP and the unemployment expansions and other programs has certainly helped to significantly insulate us from early harm. But I think as is on the mind of many of us, their expirations are looming very large. We know that the major cliffs in both of these programs are coming due now, and for unemployment, it's next month. Another major area of focus has been the support structures for working parents. The reopening and the sort of understanding of the K-12 system, childcare, after-school programs is really key for this committee and has come up frequently. And also the fact that higher ed is an important driver for jobs in the economy in the state of Maine. We are looking closely, like the Commissioner Figueroa, at what other states are doing to provide sports structures, enhancing federal programs, and looking at other types of support coming from CARES Act. We have monitored closely the 7 or 8 other states who have started these programs. Many of those states are in the extremely early days, but I would say that the Department of Economic and Community Development, the Small Business Administration, the congressional delegation is all really sort of pitching in to think about the kind of support that Maine businesses might need to survive this period. So I would say that I think probably as Mike Allen really outlined well, the economic data does not capture the extent of problems the COVID-19 crisis has raised in many sectors of our economy. We are really flying without information and instruments. Many of us didn't imagine the duration of this period, and we still don't understand the long-term duration of this economic challenge. So the December economic report will be relevant. It will help really understand what transitions and reinventions might be required for the long term. But obviously the short-term recommendations for July 15th are sort of on the top of our radar screen, as survival of many of these sectors is key. I just conclude by saying that the Economic Recovery Committee, I'm really here on their behalf. We are helping to support them as staff members, but they are doing their own work very independently. But they would certainly like to think that their work and their recommendations would be relevant to this committee. And I know the governor has placed a major task on their plate that they are taking very seriously. And again, I thank you for your interest and would be happy to answer any questions later.
Thank you very much, Hannah. I do think there might be some questions for you after we wrap up, but we're going to, in this section, but we're going to move on to Commissioner Figueroa for the moment.
Okay. Hi, everybody. Thank you, Dr. Allen and Hannah Pingree. So the first section of my presentation will be about the updates that we have for CARES Act funding and reporting. So I'd like to start by saying that we have added some links to the Bureau of Budget website on their homepage under the header Federal Assistance for COVID-19. One link shows the grant statewide. We did this spreadsheet last time I was with you on May 29th. This is the listing from FFIS that shows all of the grants that they have labeled through those 4 pieces of legislation as coming through or to Maine statewide. For some context, we have, since we spoke last, separated the spreadsheet into those grants that will flow direct to others versus those grants that will come through or to pass through state government or come to state government. Note that there is still about $170 million worth of grants that we don't yet know how they're going to flow. We'll know more about that as those are officially awarded. The spreadsheet is periodically tweaked by the feds. We will be saving the versions and we'll note the changes from week to week. The FFIS, you will note, does not have the unemployment insurance grant on it. So in the version that will be out on the website soon, not your version, unless Maureen was incredibly quick this morning, has that added at the bottom. So that basically you see that brings the total statewide to approximately 6.2 billion, with the total to and through state government to approximately 2 billion. The 2 billion includes the 1.25 of coronavirus relief funds and approximately to date 570 million for unemployment insurance. The second link we have, which is a longer spreadsheet and a little bit different colors, shows the financial orders relating to the above grants with expended and encumbered balances. This is about all of the grants flowing to and through state government, except for the 1.25, which will have its own spreadsheet. So we've received grants for approximately 731 million. We have processed financial orders, and we've expended or encumbered nearly 400, a little bit more than 400, $514 million. Remember, we don't know about that 170 million that's still out there, and so some of that will eventually flow, no doubt, onto the spreadsheet. We're trying to use the column that says funding distribution method to help people looking at the spreadsheet to understand how those funds will flow, either through a state agency program or pass through. For instance, the $43 million on the second line for education that flows through the Department of Education, but to the K through 12 community. The final sheet that you have today, it's not on the website yet, but will be soon, is the spreadsheet that specifically talks about the 1.25 coronavirus relief funds. It shows current commitments. Those are the items we've discussed before as being allowable uses per US Treasury guidance and within current agency authority. And it shows the expenditures or encumbrances as of June 18th of those commitments. Just going to talk briefly about some of those line items, including the first line item is the Unemployment Trust Fund. Approximately $270 million of CRF will be used to backfill the state's Unemployment Insurance Trust Fund, the trust, as I will refer to it. The CARES Act guidance is specific that states may use CRF to prevent expenses related to this public health emergency from causing state unemployment insurance funds to become insolvent. I'm going to discuss what this means high level. I won't be able to go much deeper than this overview, but I will be able to get answers for you if you have them. This is not meant to go into any of the Department of Labor's the new federal programs. As a starting point, 116,000 individuals have received more than 720 million in federal and state unemployment benefits as of June 11th. The trust is funded through unemployment tax payments made by approximately 45,000 Maine businesses, representing approximately 607,000 employees. These are big and small businesses. Using this $270 million will minimize tax increases for these employers. Individual employer tax rates take into consideration the employer's experience with unemployment, the amount of benefits paid out, the amount of tax the employer pays into the trust, and the size of the employer's payroll. When an employee becomes unemployed, then the trust pays the unemployment payments to that employee. Annually in October, the trust's balance as of September 30th is reviewed, and the unemployment tax rate schedule for the upcoming calendar year is determined. This schedule will then determine the tax rates each of the 45,000 Maine businesses will pay during that calendar year. The tax schedule has remained steady and has been at its lowest schedule under Maine law for the past 4 years. Obviously, when these business tax rates increase, these are monies the business must pay to the trust that they then do not have available for other parts of their operations, such as employee payroll and benefits, capital improvements, general maintenance, or day-to-day activities. Maine's unemployment trust fund balance is the 11th most stable in the nation, according to the Tax Foundation. At the pre-COVID-19 level of approximately 500 million, it was estimated to cover nearly 16 months of benefits, approximately $8 million in benefit payments made per week. Again, that's pre-COVID-19. Since April 2020 and estimated to the end of June, the trust will spend approximately $270 million on COVID-19 related unemployment claims. This is approximately $22 million per week. At this rate, the trust will be out of funds by September. Another way to look at it, over the same time frame in 2019, April to June, the trust paid $20 million. $20 million compared to $270 million. Backfilling the $270 million does several things. It prevents the trust from being depleted to zero and having to borrow funds to cover benefit costs. As a reminder, the state's required to continue to make unemployment payments to unemployed workers who are covered. It minimizes the unemployment tax rate increase resulting from this unprecedented level of benefits being paid out for these 45,000 Maine businesses. This is especially important to the smaller employers with lower wage employees. Because this tax is a higher percentage of their overall payroll expenses, increases are harder to absorb. Making up $500 million in the trust would mean more than 120% increase for these businesses for a prolonged period. The solvency and stability of the Maine Unemployment Trust is a factor considered in determining Maine's bond rating. This infusion will help keep the trust fund solvent through a period of unprecedented benefit payout. Having to borrow funds to cover the cost of benefits being paid out not only raises the risk of increased unemployment taxes for Maine employers, but slows down economic recovery. Employer-paid unemployment taxes may remain higher longer in order to not only rebuild the solvency of the trust, but also pay back any loans to the federal government that might need to be taken. If loans are not paid back within a specified period, usually around 2 years, then the federal unemployment taxes Maine employers pay, in addition to the state, will also increase. Another line item on a spreadsheet is a program that is labeled 25% share of FEMA. We are setting aside approximately $35 million of the Coronavirus Relief Fund to assist local and tribal governments and other entities, including certain nonprofits and schools, that qualify for Federal Emergency Management Agency, FEMA, public assistance with incurred COVID-19 expenses. Specifically, the $35 million is intended to provide the 25% match against FEMA's Public Assistance Program Major Disaster Declaration for COVID-19 for eligible expenses incurred on or after March 1st. Historically, the state has contributed 15% toward the 25% match by requesting an appropriation, and the entities absorb the remaining 10%. Title 37B, Section 744, subsection 2-A authorizes the state to contribute up to the 25%. In May, the U.S. Treasury Department issued verbal guidance that CRF can be used for this 25% local match. Utilizing the CRF for this match will enable a more timely and complete reimbursement to the entities approved for FEMA public assistance. This plan will result in entities receiving the 100% reimbursement of approved expenses, 75% from FEMA and 25% from CRF. The alternative is to reimburse entities for their approved expenses with 75% from MEMA, request a general fund appropriation later for the 15%, and ask that the entity continue to absorb the remaining 10%. Parties interested or eligible should visit the MEMA website, www.maine.gov/MEMA, under the Public Assistance Grant Program. Another item is the Keep Maine Healthy public health campaign that was announced, where up to $13 million will support local public health and COVID-19 prevention efforts. Recognizing that municipalities are on the front lines for community questions and concerns related to COVID-19, and that many would like to partner with the state to be part of the solution, the state will reimburse municipal costs associated with public health education and prevention activities. These would include signage, materials, website development, brochures, and mailing, physical distancing and public health support such as fences, limiting crowds in front of businesses, restaurants, bars, beaches, etc., personal protective equipment and hand sanitizer, or staff time for a code enforcement officer, local health officer, or other person designated by the municipality or tribe to be the contact for this educating the local businesses on best practices. Additionally, the state has purchased or plans to purchase PPE. We have to date spent approximately $18.1 million on the CDC stockpile, which is distributed to long-term care facilities, nursing homes, hospitals, etc. We have designated another $11 million for a 3-month supply for K through 12 for their startup in the fall. And we have some funds designated to state payroll expenses and including DVM, public safety, the health lab, the staffing and contract support for unemployment services, and some project positions. Some of those project positions include efforts in the Bureau of Budget, and will be led by Beth Ashcroft, our state budget officer. I know you all remember her fondly. A lot has already been going on behind the scenes. We've established a vetting process for expenses that state agencies are incurring, and we are vetting impacts on sectors learned by the commissioners. We are looking to understand other federal grant options that are available before CRF is used, which would be the same expectation that we would have for any locals. We're researching and monitoring what other states are doing. We are gaining as sound an understanding as possible of what is eligible and what will be required for reporting. We've established an accounting tracking infrastructure. However, we can't keep up with some of this, and so we are going to hire 3 positions to the Bureau of Budget to help keep up with spreadsheets, transparency, federal requirements, reporting, as well as helping consolidate all of the information that we are gathering. We also have a position that's helping in our Human Resources Department with our transition team as we bring state employees back into office buildings. So that is primarily my update on that reporting. And then I just want to note one more thing for the committee, which is about tax conformity. The CARES Act contains several federal tax provisions that affect Maine tax laws, including some retroactive changes back to tax years beginning in 2018 and 2019. Governor Mills continues to review the recent federal tax law changes and is considering the extent to which the administration will propose legislation conforming to certain of those new requirements. Because under current law, Maine conforms to IRS Internal Revenue Code as amended through December 31st, 2019, taxpayers filing their 2019 income tax returns by July 15th will do so without regard to the federal tax provisions enacted after that date. Other factors that will impact this decision are that we do expect additional tax legislation to come out of the current whatever's happening in Congress right now, as well as a new state revenue forecast scheduled to be released by August 1st. As a reminder, tax conformity often costs the state money as an expense or as a reduction to revenues. And I'm ready to wrap up. And so we'll do that by saying thank you to Dr. Allen and thank you to Hannah Pingree, and shows that with a number of other considerations that the Mills administration is taking strategic, thoughtful approach to the overall situation, including the use of CRF. Overarching considerations in that decision-making process are how to be most impactful for the state economy and the citizens of Maine. Where are the gaps that are already being covered, and the best avenues for providing assistance and keeping it simple, and the administration's authority to pursue those avenues. As you can hear, as part of the consideration, we're using what we already know, including April sales and economic information that Dr. Allen and Hannah Pingree just discussed. We have the CEFC meeting next week. MEPERS will be making their rate determinations at the end of June. We are closing in on fiscal year 20's year end. We'll have May sales and June revenues in mid-July. The Economic Recovery Committee report in mid-July. Commissioners continuing to assess and document the needs of their sectors. We are learning that the estimates that we included in the letter to the congressional delegation are actually are coming true and then more. The $600 federal program, as Dr. Allen mentioned, ends July 1st. So we are expecting that the feds will act before then. And we continue to press for flexibility of how CRF can be spent, the timing of the expenditures and revenue backfills, and additional funds as needed, as previously highlighted in the congressional delegation letters and these discussions. And again, we'll have RFC on August 1st. All of this is to say, we have so much more information helping with these decisions coming in the next 4 to 6 weeks. Thank you very much.
Thank you, Commissioner Figueroa. We appreciate that. So as I mentioned at the top of this section of the agenda, we asked folks to hold their questions for Dr. Allen or for Hannah Pingree or for Commissioner Figueroa until the end. So I'm going to look in the room first to see if any of my colleagues here have any questions. And I see people who are doing the chat function with their hands up, so I appreciate that. Before I see Representative Jorgensen's hand up, Representative Millet? Okay, Representative Millet, why don't you start and then we'll go to Representative Jorgensen. And if so, folks, if you want to raise your hand electronically, you go to you somehow go and raise your hand. How do you do that?
In the participant screen.
In the click on the bottom of the participant screen and you'll be able to do a hand raising thing there. So Representative Millet and then Jorgensen.
Thank you, Madam Chair. I actually have one question for each of the three presenters, and I'll try to make it very brief. For Dr. Allen, I wondered if he had a speculative figure for the shortfall in general fund revenues for fiscal 20. For Hannah Pingree, I wondered if you could quantify and maybe clarify the role of the subcommittee report that's due on July 15th on stabilizations and support recommendations, and whether you see them as budgetary in nature and how specific you anticipate them coming forward, whether we're the receiver of that information or the governor or both. And for Commissioner Figueroa, I wondered if you could provide, not necessarily today, but later on, one of the items on your summary sheet, the single sheet that talks about the commitments on the encumbered or obligated and or expended, the $26 million figure for personal services and UI contract support, I would like a breakdown of how much of that was UI versus general operation staff within the general fund budget, and how much of it relates to new staff as opposed to substituting CARES money for existing budgeted personal services monies on the general fund. And again, on that one, I don't expect an answer with specifics today, but maybe through Maureen, we could get some help down the road. Thank you.
So I think your first question was for Dr. Allen, is that correct? Thank you. And then we'll go to Director Pingree.
So I think we had mentioned the last time that we had used the stress test, the 2018 stress test, to try and inform ourselves of what we thought the shortfall would be for this fiscal year. And utilizing that, we had estimated a $200 million shortfall. Now, again, that doesn't take into account allowing taxpayers to defer their final and estimated payments to July. That's assuming those payments had come in on time. How much would we have lost? I would say based on what we've seen through May and what we're seeing so far in June, that 200 is overstated. I would guess it's going to be closer to 150 million. And that's going to require us to see those July payments on income taxes before we can kind of think about, how that fits in with the original 200 million. But I think we're going to be closer to 150, maybe even less than that if the sales tax, which represents May sales, comes in a little bit better than we currently think.
I'll address
Thank you.
Representative Millet's second question. I think it's a good one. I think the committee is looking at their July 15th report. Kind of they're in the stabilization and what do these businesses need to reopen. So the urgent and necessary concerns for each sector in terms of their long-term viability. I would say it is partially about the short-term market challenges, but also those things that some of these sectors need to be able to reopen and to operate. I think I'm sure that the representative's question is really about the budgetary impact, and I would say while I don't know the specifics of the recommendations yet, because they're really still working hard on those, I would imagine that they would help outline and really clarify the most urgent needs of these industries, whether it's, frontline childcare workers and how do we make sure these types of services stay in businesses, or what the tourism and hospitality industry is facing this summer, and what they will need to be able to have their businesses continue until continue just period. I think that those things will be quantified. I think the committee is engaged with federal representatives as well as folks like Commissioner Figueroa in trying to understand the opportunities for state and federal support. So I think they will clearly outline the urgent needs and help prioritize them. And they certainly will be delivering those recommendations to the governor, but would love to be in dialogue as well with the legislature about those details. So I would say that on July 15th, that will be a public report, maybe even a couple of days early, and it will be something we'd be happy to share with this committee.
Does that answer your questions? Thank you both. The next person.
Oh, do you mind if I just quickly say?
Please go right ahead.
Yeah, I just want to say that I will get a breakdown of those amounts. I do want to say that primarily it is overtime, hazard, current salaries for existing staff within public safety, HEDL, DVM. The new staff would only apply to unemployment insurance because, as you are aware, I believe that originally there were 13 people handling 400 calls at unemployment. And so we've added a call center as well as additional staff to that effort. So I will break that down, but I just wanted to say primarily it's the new staff are in UI as well as the few project positions that I mentioned.
Thank you all. Representative Jorgensen.
Thank you, Madam Chair. First, I just want to say thank you to Commissioner Figueroa for this analysis of what's been happening with the coronavirus relief funds to date. I think you've made some good decisions so far. I guess the question that's come to me was I'm hearing from different entities within government who are curious about plans, particularly for facility modifications. I'll just say it's the judiciary branch, which I've heard from, and they're very concerned about, getting the courts and things up to speed so they can actually start working again with things like jury trials and trying to get their hand around their deepening backlog. So I guess they've got a sense of rising urgency. And I noticed you've got quite a bit of uncommitted funds in the facility costs. And I just wanted to have a sense of how you're going to be allocating those and what the plan is to help organizations like the judiciary get along with and make this work.
Thank you. That is part of the work that's happening with the transition team that I discussed, and also needing to understand what exactly needs to happen in not only judicial, but across state government, and including whether we need to outfit as many cubicles as we thought we might have one day, because we'll probably have a significant part of our population that continues to telework. So we have a separate subsection of that transition committee that is working specifically on facility asks, and we do have information from judicial about what they're estimating. They are definitely on our radar.
That's great. I appreciate that.
Representative Guttine.
Thank you, Madam Chair. Again, I had questions, one each for each of the panelists, and I think that the exchange between Dr. Allen and Representative Millet answered the question I had. It seems to me like we made some assumptions about how we would wrap up fiscal year 2020, and that right now those assumptions are holding roughly pretty well. And so again, I think that's encouraging news, now that we're in the last month. So thank you for that. And And again, I know we're running a little bit late, so I'm going to sort of run through my questions really quickly. They might sound like statements, and people can just disagree with me if they disagree. I want to thank Director Pingree for the update on the ERC. Again, you know, it is, I have sat in on a number of those meetings. I've been impressed with the conversation. I've sat in on some of the subcommittee meetings too. So again, I think I understand the way that committee is approaching its work. It has to be, it's only natural though for the committee and the subcommittee to be aware of the $1.25 billion in COVID money. So, you know, and the benefit that could have, you know, with respect to helping our economy recover. I just want to say that I know that as our committee does our work and as that committee does its work, to the extent that money is being discussed as possible sources for funding things, that we just keep sort of informing each other of that. I don't want those efforts to become, you know, I know they're going to run in parallel, but I don't want them to become competitive, you know, and so I welcome the opportunity, Director Pingree, to continue to hear from you and from members of that committee, you know, over the next few weeks, you know, as you're getting ready for your July 15th report, and as we continue our work, you know, I just want to make sure that we're not ever working at cross purposes as we look at that money as a source for some very important solutions. Again, you know, I saw the agenda for this morning. I wasn't able to listen in, but I'm glad that you are looking at the disparate economic impacts that, you know, that we know are going to impact different communities in Maine. So again, that wasn't really a question. It was more of a statement. And if you want to respond, feel free, Hannah.
There's the thumbs up.
Okay, there you go. A thumbs up. Very good.
Chairman Gattini, I know, I think that's well said. And I know that the governor and commissioner and others want our work to be aligned. So I think the work should be complementary and really should just be another avenue for sort of a good understanding of what's happening and sort of the urgency of you know, how we prioritize, you know, what is limited funds and even limited hopeful funds that will come from the federal government. I think we're well aligned.
Yeah.
And I will say the co-chairs are very willing and able to come here, or any member of our staff or myself, I'm happy to come back. So.
Thank you. And then again, Commissioner Figueroa, again, thank you for the presentation. I think the, you know, we've gone from a conversation over the last couple of meetings about, you know, the need to hold on very closely to a lot of that CARES Act money. And now, again, we're beginning to see a commitment by the administration to utilize some of that. And I really want to make sure that we continue to work together and talk about what the best uses are of that. And I really don't, I have to admit, I am not an expert or have deep understanding in the UI system or the trust fund. I think that we're going to have to, I'm going to need to understand that a little bit better, whether whether I try to do that off mic or we talk a little bit about it more in detail on mic. You know, I'm hoping we're going to be able to do that. And also the tax conformity issue. Again, we probably don't have time today, but I think that, you know, understanding, you know, how that could impact us going forward in the future on the revenue side, you know, and also whether it has any sort of tangential impact to the CARES Act money. I'd like to understand that a little bit better, but I don't think we really have too much time to dive into that today. Very interested in hearing from MEPers also in our future meetings. Thank you.
Okay. Thank you all. I see a question from Representative Cashel.
Yes, it's more of a comment than a question. And, you know, I appreciate all the information that we've heard today and in previous meetings and all of the comments. I may agree or disagree with many of them, but I just wanted to make a comment as we do our committee work, and we need to keep in mind that we need to hear from the full legislature, who also represents people in Maine, and they need to have their voice heard and to put forth any ideas. And I know that there's opportunities outside of session, but they need to be able to put forth their ideas on the use of the $121.25 billion. I just made that comment just to let you know that I'm concerned about that.
Thank you, Representative Cashel. Representative Martin has a question. Hang on, I got to unmute you. I think you might need to unmute yourself as well, John.
Okay, I think I'm unmuted now. Right?
Yes, go ahead, John.
Am I still muted?
You're good.
Okay. And on the second page, it has the HRSA program, the monies, and it says community health centers expanding capacity for testing. And what has happened is that the assumption was that they would get the money for the testing. When they sent in the bill, they were informed that they only will pay for the testing if it was positive. And so the my health center, for example, we've got, I think it's like 1,000 that have been tested. And I mean, I think we have one person has been positive, whatever. And so now we've got to go back out, figure out a way to build everyone. I didn't think that this was the case. So maybe Commissioner can follow up with that.
I will, yes.
Okay, thanks.
You're going to follow that up at a later date, Commissioner? Great.
Thank you.
Just checking to see if there are any other hands up for this particular group of presenters. I don't see any. So I think we have wrapped up the first part of our agenda. I want to thank everybody from the administration, Director Pingree, Dr. Allen, Commissioner Figueroa. Obviously, you are welcome to stay on, and we appreciate everything you're doing and all your good preparation and communications with our committee. Thank you very much.
Thank you for the opportunity to be here. I would just like to wrap up by saying that, especially what Director Pingree just mentioned, that we do anticipate that the work that's being done on all that list that I mentioned is information that flows through this committee as we've been discussing. How does appropriations right now during this particular environment that we're in learn about everything that's going on? And so it's just one more piece that ends up going through your funnel. And then I did just want to mention, although I'm showing it in a spreadsheet format now, all the items that are outlined on that 1.25 sheet are items that we talked about the first time I was with you at the end of May. And any additional information that you might need, you know how to get a hold of me.
Yes, we sure do. Thank you.
Thank you. Happy weekend.
Thanks.
Thank you all. So as folks have noticed, we are running a little late, and that has caused a little bit of a need for some changing around in our next group of presenters. Thankfully, some of them are more flexible today than others. So we're going to switch around our presenter list, and we're going to have Amy Gallant from Good Shepherd Food Bank start us off today because she has a hard stop at noon. And then we'll take it from the top, go back to Eric Meyer, then Art Blank, Jennifer Putnam, Bob Fowler. So Amy, you wouldn't mind introducing yourself and tell us what is going on at Good Shepherd?
Sure. Thank you so much for your flexibility. My 1-year-old fell off a bed this morning, so we're going to the pediatrician at noon. So thank you. And if any of you have been in that position, please send me a note and tell me everything's going to be okay, because right now I don't feel like that. So my name is Amy Regan Gallant. I'm the Vice President of Public Policy and Research for Good Shepherd Food Bank. And on behalf of the Food Bank and Kristen Maley, the Food Bank President, I want to thank you for allowing us to present today. I did provide Maureen a 6-page document of everything that I'm going to be talking about. I hope that you did receive that. And for the sake of time, I'm not going to go through 6 pages. I've condensed it to 2 pages for you, but I'm certainly happy to take any questions on or offline about any other details in the document that I've provided Maureen. As we all know, the recent and ongoing COVID-19 pandemic has had a great impact on the food bank, our pantry network, and Mainers experiencing food insecurity, some for the very first time. The following are the priorities that Good Shepherd Food Bank has identified as most critical needs at this time for our organization to meet the growing need of hunger in Maine, and for which we have not yet secured a funding source. So respectfully, I will start there. We have estimated a cost of $150,000 for a generator for the Hampton Good Shepherd Food Bank facility. This is our newest facility, it's our largest facility, and it is in critical need of a generator. The COVID-19 crisis has solidified Good Shepherd Food Bank's role in the state's emergency response system, and the Hampton facility did lose power early on in the COVID-19 pandemic, but fortunately, the power was restored without any loss of inventory. If power went out at the Hampton facility without a generator during this or any future state emergency, the results would really be disastrous. And for the sake of full transparency, we did send an email to the governor's office inquiring if this would be an appropriate allocation of the CARES Act funds. And then the second pool of money that we would respectfully request for your consideration is an additional $2 million for Mainers Feeding Mainers. You are very familiar with Mainers Feeding Mainers due to the good work of my predecessor, Claire McConnell. And I want to talk a little bit about why this has become more relevant in the pandemic. As our pantry partners have settled into their new normal and are comfortable to resume handling larger volumes of perishable food, local produce is far more cost efficient than buying any kind of processed shelf-stable food. And all of our food pantry partners across the board report that the first thing to go when they open their doors are the fresh local Maine vegetables. An investment in Mainers Feeding Mainers produces a double impact, as you know, by providing healthy food for people in need and investing in Maine farmers during a particularly vulnerable year. And this is really important. We've heard from a number of our farm partners that while the program has always been very important for them, this year has never been more so. When restaurant orders and other large orders have been canceled, our Mainers Feeding Mainers contracts are upheld regardless of the pandemic. We want to thank Commissioner Beal for including Mainers Feeding Mainers in her remarks to the ACF committee last Friday and in her CARES Act request letter that she submitted to the governor. And specifically, this additional allocation will support the purchase of more locally produced fruits, veggies, meat, seafood, and dairy products. And we asked our Mainers Feeding Mainers program director to estimate the capacity that both the producers and the distributors could take on at this time. And she believes that a $2 million allocation, in addition to the currently allocated $1 million, is the capacity. I want to talk a little bit about the food bank's response to COVID. We estimate that the cost of our response to the pandemic will total $6.3 million in additional resources. This represents a 150% increase to the food bank's baseline 6-month operating costs. So last year at this time, 6 months cost significantly less than this time. In May alone, just last month, we purchased 370% more food than we do in any other month. So in May alone, we purchased 370% more food than in a normal month. The challenges posed by the crisis are amplified as food donations to the food bank and our partners decline due to increased consumer demand and supply chain challenges that we've identified that we didn't really see before, and less shelf-stable food is available for purchase. There were actually 2 instances over the past 3 months of the pandemic where we literally ran out of shelf-stable food. As vendors' deliveries were delayed, they couldn't get food, we couldn't get food. We worked with Hannaford, and in total, over those 2 instances, we purchased and delivered over 30,000 Hannaford gift cards at a cost of $836,000. We wanted to make sure that we didn't just have nothing, so the Hannaford gift cards were a good second. Furthermore, hunger relief agencies, our partner agencies across the state, are seeing a sharp decrease in the volunteer workforce. Most of them are either seniors or they're school and corporate groups who are just not available to volunteer right now. I want to talk about the rising unemployment and hunger and poverty due to the pandemic. We have estimated that rising unemployment, poverty, stay-at-home orders that are impacting Mainers who are already at risk of hunger, as well as those who have never experienced hunger before, could result in an additional 67,000 Mainers experiencing food insecurity. This is an increase of 40% of people who are experiencing food insecurity in Maine. And unfortunately, this 40% projection is the best case scenario, and it's dependent upon currently available benefits. There are a number of federal considerations that could increase or decrease this projected impact of Mainers experiencing food insecurity. I am happy to discuss those in further detail if any committee members have questions, but because they are at the federal level, they're provided in the document, they're detailed in the document. I want to talk a little bit about the impact to our pantries. We have been in constant contact with all 500 of our food pantries, meal sites, shelters, school pantries, to assess the impact throughout the entire COVID experience. We have sent out 5 surveys. The most recent was just last month. And again, you have all of the percentage responses that you would ever dream of wanting. But a high overview is that our survey respondents continue to share with us that they had an initial spike in need. They have an ongoing increase in need. New households are presenting at pantries for the very first time. Pantries have a pretty wide variance of ability to meet that need, again, due to the volunteer force, due to lack of access to food, the new and ongoing needs of specific food and particularly non-food pantry items. So again, all of those are well documented in the document provided to you. In conclusion, I want to talk about two more highlights: the impact per county and the impact on children in Maine. So we have assessed the local impact of COVID on hunger in each of Maine's 16 counties. Saginaw, York, Cumberland, and Knox counties are projected to see the greatest increase in the number of people struggling with hunger due to COVID. Piscataquis, Somerset, Aroostook, and Washington will see less of an increase, but they still rank as having the most extensive persistent hunger in the state. And in fact, these counties have the highest rate of hunger in the northeastern United States. Piscataquis County will see the lowest overall growth in food insecurity, but will still see a substantial increase. And then these projections absolutely affirm what we're hearing from our pantry partners. Our pantry partners and meal sites in the southern counties have seen the needs skyrocket. Our partners in the northernmost counties are seeing big increases too. And unfortunately, these counties are just more accustomed to seeing higher rates of hunger even pre-pandemic. So again, a couple of numbers here before we talk about children, and then I'm done. Pre-pandemic, Maine had approximately 180,000 people struggling with food insecurity. We believe that this number could climb to as high as 250,000 people, 250,000 people, should rates of unemployment and poverty sustained at a high rate. And that number will increase even more if SNAP changes are approved at the federal level. Again, happy to talk about those in more detail. And unfortunately, this is no surprise that Maine's children will see the highest increases in levels of food insecurity due to COVID. Cumberland County's rates of children food insecurity is projected to increase by 59%, with Saginaw and York counties not far behind, bringing the overall rates of child hunger in Cumberland, Saginaw, and York to around 1 in 4 kids. And then the rate of child hunger in Piscataquis, Somerset, Aroostook, Washington, and Oxford will likely be 1 in 3 kids. COVID-19 has brought a swift and crushing blow to the progress we have all made over the past 10 years to improve access for food for Mainers struggling with hunger. We have been buoyed over the past 3 months by overwhelming support by our partners and thousands of Mainers who have contributed to our response efforts. But clearly, we still have our work cut out for us. Our state's recovery from this crisis may bring the greatest demand that our charitable food network has ever seen. We know that this is just the beginning. Thank you so much for your time and consideration today, and thank you again for your flexibility in moving me first. I'm happy to take any questions that you may have.
Thank you, Amy. I just want you to know that both Dr. Sanborn and I think your baby's going to be just fine.
Thank you.
Are there any questions from the committee? I'm going to do a scan for any hands up. Don't see any.
Okay.
Okay. Thank you very much, Amy.
Thank you all. Have a good afternoon.
You too.
Bye-bye.
So the next person we have, going back to our original order for this block, is Eric Meyer, who is the CEO of Spurwink. I always like to remind folks that I have served on the board of Spurwink for close to 10 years as a volunteer. I obviously get no personal benefit out of that position, but I do like to be fully transparent. And Eric is here to speak not just for Spurwink, but for several other folks as well. Welcome, Eric.
Thank you very much. Hi, everybody. Thanks for including me in this important meeting. I really appreciate it. So Senator Breen, Representative Katine, members of the committee, thanks so much for the invitation to speak with you about the impact of the coronavirus epidemic on community behavioral health organizations, and more importantly, the people that we serve. As Senator Breen said, I'm Eric Meyer, President and CEO of Spurwink Services. Spurwink serves over 8,500 Maine people each year with 1,100 employees statewide. And again, as Senator Breen mentioned, I am speaking on behalf of Spurwink, but also my colleagues in the Behavioral Health Community Collaborative, as well as the board president of the Alliance of Addiction and Mental Health Services. We are asking for state government to establish 2 COVID relief funds for community behavioral health. One fund to address the existing funding crises for these critical services, and another to fund expected needs in the coming year. As you're aware, we're in the midst of a trifecta: the COVID epidemic, a rapid economic collapse based on this epidemic, and the public outcry that we shift our policing away from practices that reflect systemic racism. All of this in addition to a raging opioid epidemic that only seems to be growing in response to these crises. Behavioral health systems and services are at the center of each of these. The services that we provide as community mental health providers were severely impacted by COVID, both our ability to deliver outpatient and residential services, and by the dramatically increasing needs of Maine citizens as they endure this pandemic. The economic collapse has had a severely negative impact on our workforce, one that has been stretched to the limits before even any of these crises had hit. I know that I don't need to remind this committee how fragile and underfunded the community-based mental health system was before these crises. Many agencies and programs were barely holding up. We're facing workforce shortages and our inability to compete for workers due to inadequate reimbursement, trying to bring people home from out-of-state placements, shifting department priorities, and an ever-increasing need for both child and adult services. We've experienced program closures, agency closures, and a reduction of access to services at a time when the public need for our services is increasing. And then COVID hit. This is a partial list of the ways in which we were affected in our ability to serve our clients, all of which required us to find additional funding. Purchasing huge quantities of personal protective equipment, PPE. As Spurwink alone, we've spent over $200,000 in climbing. Near universal adoption of telehealth and online work capabilities. That meant the purchase of expanded IT networks, equipment, internet, phones, phone minutes for staff and clients. At Spurwink, our IT-related costs due to COVID so far are over $200,000. Incentive pay for many of our employees to ensure that they continue to come to work to serve clients, particularly extra pay for the hazardous duty of serving clients who are COVID positive. Our special purpose private schools, therapeutic preschools, and adult community support programs either closed or served far fewer clients with a distance learning model. We lost staff due to their inability to find childcare for their own children or due to illness. At Spurwink, over 45 staff are currently out of work for these reasons. The calls to the crisis system and warm lines are increasing. The need for mobile crisis services is increasing. Some adult residential programs are scaling back and serving fewer people in order to ensure social distancing and safety. Several agencies had and continue to have outbreaks in their facilities and must do major building, air, system, and physical plant changes to accommodate social distancing, disinfecting, etc. Spurwink, even today, is experiencing a couple of outbreaks in our adult programs, and we've experienced them previously in our children's services. Staff had to be tested frequently and has to be on an ongoing basis, which is a large and growing expense for all of these organizations. At Spurwink, we spent over $40,000 on testing with much more to come. As you can see, the fiscal impact on community behavioral health organizations has been huge. There's been some help from DHHS, and we appreciate what they have done, but that assistance has been relatively small and time limited. Many agencies have lost millions of dollars, and their year-end losses are predicted to be between 10 and 15%. Some are predicting revenue loss of up to 40%. This pandemic is clearly not over. As Dr. Fauci said this week, it's too soon to actually talk about a second wave, as we're not out of the first wave yet. And at the same time, we're very concerned about predictions of a fall increase in cases. It's also important to note that the need for mental health services has not peaked. Anytime we go through a national crisis that affects people's lives so dramatically, it often takes time, say 3 to 12 months, for the mental health impacts to manifest and for people to seek treatment. Also, the needs of people with chronic and persistent mental illness tend to increase in severity over time following a crisis. The community mental health system is in a crisis of its own. We face the very real possibility of doors closing on services and agencies that are desperately needed. When we look at what can be done, it is difficult to give you an exact number of the money lost and what we need in the next 12 months. Each agency has had specific needs. Some have been able to access federal assistance, while some, like Spurwink, have not. Some have seen a reduction in services, some have not. So there's not an across-the-board solution here. What we ask of you today is to create a streamlined, rapid response behavioral health COVID relief fund for community behavioral health. At the end of this month, providers will know that what they have lost and spent due to the virus. They would then be eligible to apply to the fund to keep them whole. We estimate the need here to be approximately $15 million. And going forward in the coming year, we recommend another COVID relief fund that is available on an as-needed basis. Again, we don't know what is in store, but we would recommend $20 million be set aside for the ongoing COVID relief fund for community behavioral health. Again, adequate community mental health services are a central piece of everything that is going on, and the system is in trouble. Please direct a portion of the CARES Act money to address these needs. Thanks again for this opportunity to address the committee.
Thank you very much, Eric. Are there any questions for Eric Meyer, Representative Gatine?
Yeah, thank you, Mr. Meyer. Unfortunately, I don't think there's anything you just said that is too surprising to me, and I appreciate you giving us a lot of this information in writing. I don't need you to answer this today, but as we move ahead, I would be really interested. I know the HHS committee is too, in what the telehealth experience has been like from a service delivery perspective, and I'm really interested in hearing provider perspectives, especially providers that may or may not have been doing a lot of their services utilizing telehealth. Thank you.
Thank you. And if I can make a quick response to the comment about telehealth, I would say that the support that the department and main care has made possible for increased and expanded telehealth has been invaluable. And one of the asks that I think many of my colleagues would have, and certainly we would at Spurwink, would be that support continue, that it not be time limited, but that there will be a way to continue it. It has been a lifesaver for many people. It does not work for everybody, and it certainly is not the panacea, but it's an important part of how we're trying to manage the need.
Thank you very much. I'm not seeing any hands up. Let me just check one more time. Okay. Thank you very much. I love when people have a list of problems and a proposed solution. So thank you. All right, so the next person we're going to hear from is Mr. Art Blank. He is in the healthcare hospital arena, and we welcome you, Mr. Blank. Make sure I can get you on here. So if you could start your video. There you are.
Yeah, I assumed you were controlling all that.
Yes.
So, good morning, or I guess now it's good afternoon. And Senator Breen, Representative Gatine, and all the members of the committee, I really appreciate the opportunity to come and speak with you today.
Mr. Blank, pardon me one second. Could you get a little closer to your microphone? It's a little bit hard for us to hear you. Thank you.
Is that better? Great. So again, thank you so much for giving me a chance to speak with you today. I'm the president and CEO of Mount Desert Island Hospital, which is a critical access hospital in Bar Harbor. We are a 25-bed community safety net provider. We also operate a 75-bed retirement community, the Birch Bay Retirement Village, that includes a memory loss unit as well as other residential care services. I was asked to speak to you about our challenges, and I knew you didn't have all day and into next week, so I'll try to keep my comments brief, and they fall really, the challenges fall into three different categories. The sort of the one that has the biggest numbers attached to it is the lost revenue that we've experienced. We have we had a very interesting experience. Hospitals, the federal government and state government directed us to cease non-emergent services back in March. We received those orders or advice, actually from the federal government, it's more advice. And as we were analyzing how to go about doing that, our community did it for us. On March 17th, we have a common understanding at our facility that the curtain dropped and people stopped coming to the hospital. And our experience is very consistent with the national experience. Our revenues dropped by about 50% that day. And the interesting challenges is that some of our service lines dropped a lot more, particularly those that generate some variable revenue for us. Our surgery was down 75, continues to be down 75%. And this was a very consistent experience nationwide, and certainly within the state of Maine. Now, since then, in April and into May, the experience of Maine hospitals has actually varied a bit. In the month of May, our revenues were 66% of what we would have expected from the year before. So we lost a third of our revenues in May. Statewide, the experience is anywhere from 60 to 85% of expected revenues at this point. For the state as a whole, which I think is the best way for us to talk about this, we've lost, we estimate that as the state as a whole, we've lost about $600 million in revenue so far. And we've received some federal support, some significant federal support through the CARES Act and some other things, but we're still about $250 million in the red. And we are, as I said, our hospital in May, we were at 66%. I don't think we've gotten above 70% in June, and this trend continues. So we do expect that there's going to be a significant need for the state to provide some support, hopefully through some of that CARES Act funding that's been discussed. The Hospital Association, of which I'm a member of the board, will be providing you a request probably next week with a lot more details about the lost revenues and a request on how to help support us. The other two categories of impact that COVID has had on us, one is pure supply chain. I mean, we have an incident command structure as most organizations do, and we spend most of the time in our incident command structure tracking our supplies on a daily basis. We still have a significant shortage of surgical gowns, and all kinds of masks are in short supply, and the other supply chain issue that we constantly up against is testing capacity and testing supplies. The third area of concern is just operations. As we try to figure out how to safely bring people back into our safety net system, people need to be able to access healthcare for their chronic diseases. We are working very closely with young parents in our service area to try to get children back onto their vaccine schedules. All the same time that we're working incredibly hard to keep our patients safe, our residents at our retirement community safe, as well as our staff safe. And remember that this, the challenge for hospitals and other healthcare providers is that we're doing all of this. I won't say we're running blind because we learn new information every day, but this virus, as it is for everyone, is new to us. And we're learning best practices literally on a daily basis. So part of what we do, there's the old joke about trying to drink from a fire hose. Is so especially true right now. So we're working very hard to do all of those things. At the same time, trying to make sure that we understand best how to access funding during this critical time. In our hospital, and again, that's why I think from a financial standpoint, it's best to talk about statewide because each of our situations is different. We were fortunate enough to qualify for the payment protection program, which very few hospitals were able to access. So our percentage of the federal support that came to our hospitals a little higher than many others. That doesn't change the fact that we're operating at 2/3 of our revenue base. So that money is not going to last us for very long. But I think the committee obviously needs to really look at that much more on a statewide basis. And I know the Hospital Association is well represented in talking to you about that. So as I said, our challenge is really day to day trying to make sure that we have a safe environment. Again, we're a small hospital, which means physically we don't have a lot of flexibility. So as we work to make sure that patients can come in and they can be appropriately socially distanced, but at the same time receive the services that they need, while trying to make sure we're arranging for the testing capacity that our community needs, is just an ongoing challenge for all of us. And I'll be happy to talk in much greater detail about any of that if you would like. I do want to speak a little bit about telehealth because that is one of the things that we've spent a lot of time working on. We were doing a limited amount of telehealth, actually as originators in some pilot programs with our island-based partners. But we have invested heavily in time and energy in expanding both telephonic consultations with our patients and more recently video conferencing. I can't tell you, I can't stress enough how much challenge that has been because of connectivity problems in our service area. That's a huge issue for us. And the other issue for us going forward, which isn't so much a state problem, again, I want to echo, I think, what Eric said earlier. The Medicaid program and the department has been very, very supportive of helping to promote telehealth services. The federal government has been the exact opposite. And the Medicare regulations is why we did not pursue a lot of telehealth services in the past. And because a lot of those have been waived, we've quickly ramped up those capacities, and we need as much advocacy as we can muster to get those waivers solidified in we law. It's been a great value to the community, particularly in the area of behavioral health. Our behavioral health service, and we provide behavioral health services to our entire county, have been almost exclusively done through telehealth for 2 months now. The other thing I wanted to quickly mention, and then I'll go and I'll be happy to answer any questions that you have, is what the work that we've done in our community. Because one of the things that we're particularly concerned about here in Bar Harbor is we're not thinking as much about a second wave in the fall. We're thinking about a first wave this summer. We've been fortunate that our community has stayed safe. We actually have a very conservative community when it comes to providing for their own safety. Our community has done a great job of distancing and masking. However, we have a slew of other people coming to visit us, and they've already started. And we formed a task force in conjunction with Healthy Acadia, our community health agency, town managers, our chamber. Representative Hubble has been very, very active and supportive of our task force, as well as Senator Lucchini. And we have, at this time, we've actually secured 30,000 medical grade masks, not hospital grade, but medical grade masks that we're distributing to our community, because we recognize that if our businesses are promoting and masking appropriately, we have a greater opportunity to control the spread of COVID this summer. We're also working closely with the commissioner and developing a pilot project to do asymptomatic testing for businesses for their front-facing employees. Again, we consider that a key strategy to help mitigate the spread of COVID this summer. And we're hoping to be able to start that in the next few weeks. So again, I'll stop there and just again offer to answer any questions that you have, and really encourage that when the Hospital Association presents the huge financial challenges that Maine hospitals are facing, that we can find some solutions for.
Thank you very much, Mr. Blank. I think we're all aware that the hospitals have gotten some direct assistance from the federal government, but it has come far from making them whole. So we're not working under that illusion for sure. Are there any questions for Mr. Blank? Representative Gatine.
Yeah, and again, in the future, I don't think you need to respond to this now, Mr. Blank. You know, again, I think we're going to have to look at. I'm very concerned about the negative health impacts of all these people who've been delaying care as hospitals have, you know, had to move to different operational models over the last few months, including shutting down elective services. And again, I think as we come out of this and try to recover, I'm sure that's a topic we're going to be talking about, probably in other committee rooms, but maybe a little bit in this one too. So again, it's something I'm just very interested in. Thank you.
Thank you. And I would add the other concern that we have, because that's a huge one, the other, working with our retirement community, the isolation that our residents have been forced to accept in order to keep them safe from COVID is also going to have some significant health issues as we go forward.
Thank you. I don't see any other, oh, I do. Representative Hubble has a question.
Thank the hospital for the leadership and cooperation with the Department of Health and Human Services to make the state's vision for expanded testing move forward. So thank you for that work, Art. Thank you for being here today.
Thank you.
Thank you. Any other questions? Okay, I don't see any. Next, we're going to hear from Jennifer Putnam, who represents Waban. And Jennifer, hang on one second. If you would turn your video back on. There we go.
Hi. Thank
Hi.
you for giving me the opportunity to speak today and share some of our experiences here at Waban. There's no doubt that COVID has cut a wide swath of heartache across Maine, and we're just one of many in a fragile network of state-supported Medicaid providers. We're a 50-year-old nonprofit providing kids and adults with intellectual disabilities and autism medically necessary services. We have 450 employees, and we're an economic driver in our Sanford, Maine community. Many of the organizations like ours scattered throughout Maine are definitely the economic drivers in their own communities as well. There's a misconception that IDD services are not an integral part of the state's community, but in fact, we've got over 12,000 direct care workers who care for children and adults with IDD. Hundreds of millions of dollars flow into Maine through the Medicaid waiver services that agencies like ours provide. COVID has hit the IDD community very hard, particularly our group homes. IDD group homes have made up nearly half of the state's outbreak sites. At Waban, our 20 homes, 2 are closed, have not had an outbreak yet, but we're an outlier. Just about every other group home agency in Southern Maine has had an outbreak, and many are struggling to staff those homes. Our DSPs are trained to provide some personal support and to dispense medications, but they're being asked right now to do far more than this. Most provider agencies haven't had nursing staff or typically haven't had PPE supplies on hand prior to COVID. And providers are now in the position of asking minimum wage DSPs to put themselves and their families at risk to care for sick group home residents, as well as manage aggression or destructive behaviors that some residents exhibit, some of those who aren't able to understand the why of so many new restrictions placed on them. We've asked a great deal of families and guardians as well. Some took their family members home, and now they're struggling with their care, both financially and emotionally. Families have had to adjust to new technology for visits with no hugs or other physical contact for months. The Office of Aging and Disability Services under Paul Saucier has provided opportunities for dialogue and information sharing, and we are most grateful for that. There's a fundamental difference, though, between being heard and getting our needs met. And what the state has been able to provide thus far is inadequate for a disaster of this scale. What we need is not even to be made whole, but something to keep this destabilized system in place, so we can hold on to the staff necessary to support and care for thousands of kids and adults with IDD and autism. Before COVID, the long-term care workforce was recommending a direct care wage of 125% of the minimum wage. In other words, we were already teetering on the edge of a crisis. Waban already had hundreds of open shift hours, and now our workforce is essentially at a breaking point. We've had few applicants come through our doors, and for the few job seekers out there, you can imagine how many would even want to come to work in a high-risk congregate setting for barely minimum wage. So our goal has been to retain our current DSPs, who, like everybody else, have endured tremendous hardships themselves: closed schools, daycares, sick family members, partners out of work, not to mention everyday hardships, unaffordable rent, divorce, family issues, car troubles. We've put some measures in place: an employee loan program, payment for the employee's portion of health insurance, free meals to all our residential staff on shift, a $2 an hour incentive pay. We put many costly measures in place to reinforce our primary objective of keeping our residents safe. No visitors, fever and health screening of staff, no sharing staff between homes, etc. And the list of extraordinary costs that we've incurred, as you've heard from other providers, is extensive. Tens of thousands of dollars spent on gloves, masks, disinfectants, meals, technology, equipment, overtime, etc. One example, our 22 group homes used to do their own grocery shopping with the residents, but early in the pandemic, we began having difficulties reliably accessing groceries and cleaning supplies due to long lines, canceled orders, and food shortages, not to mention the risk of COVID exposure. We quickly stood up our own food and supply chain, requiring 2 full-time positions to place food orders, receive and store the commercial deliveries, and then pack and distribute the groceries to group homes every week. The Paycheck Protection Loan was a lifesaver for us. It got many of agencies like us through the first couple of months of lost revenue. But that money has been spent, the wages have been paid, and we're faced with looming program losses in the coming year. The state's Appendix K waiver offered some minor relief, mostly expanding the ways in which we're able to deliver Section 21 and 29 services. It provided us with a 90-day rate increase of 10% for our waiver services. To put that into context, the rate increase covered our additional $2 an hour that Waban gave direct care workers and a small portion of the employee health insurance premium. The state let that 10% increase expire on May 31st. We're continuing to pay the extra wages from our savings for now, but not all providers are able to. Our developmental preschool program and K-4 special education program has been devastated. There's been no relief offered for Section 28 or Section 65 services at all, the behavioral health services. We furloughed 46 early childhood staff in March, and we continue to pay their insurance premiums because we feel like it's the right thing to do. Distance learning, telehealth has been next to impossible, as you might imagine, for a 3 or 4-year-old with autism. We're planning to try and reopen at 25% capacity in July after almost 4 months with no revenue. Waban closed multiple residential homes, stopped operating our day program, and furloughed administrative staff as well. Our services are cut to the bone, and there are similar stories across IDD providers in Maine. Some are not going to survive, and the health and safety of our group home residents is at an historic low. Our agency and all ID providers will be operating at a structural deficit under these conditions. Last year, we provided 820,000 hours of critical medically necessary services. In the upcoming year, for every hour of service we provide, our expenses will exceed our revenue by 80 cents. You can do the math, but this is hundreds of thousands of dollars of deficit we are already planning on. The warm fabric of the safety net for some of Maine's most vulnerable people is tearing as we speak. We need to pay our direct care workers the hazard pay they need and deserve. We need to preserve community-based services across the state before it's too late. Our recommendations are to amend the Appendix K waiver, extend the CMS-approved rate increase past May 31st, and increase the rate to 25%. To use the CARES Act funding to provide temporary retainer payments for both adult IDD, community and work supports, as well as children's services in Maine Care Sections 28 and 65. And to amend Maine Care rules to permit the use of extraordinary circumstances allowances across other Maine Care sections, including 13, 19, 20, 21, 29, 28, and 65.
Thank you, Jennifer. Sorry, I had to get my buttons all pushed correctly.
That's okay.
We really appreciate you coming on and sharing this. We've certainly understood that anyone in congregate living is at a particularly high risk for COVID. And given that generally group homes don't, they have sort of a minimum of PPE because they're not really medical facilities. I'm well aware what a steep hill that was for providers like you. So thank you very much for letting us know what's going on, in particular with your organization, and especially your families.
Thank you.
Are there any questions for Jennifer? Representative Gattine.
Jennifer, thank you again so much. And we have written copies of the outline or of the remarks you gave us. Is that right?
I can send them along. You have some copies of some press articles about the situation.
I saw that, and I saw your letter to Governor Mills also. The issue about the K waiver expiring, I know that a lot of states applied for similar waivers from the federal government. Are we unusual in the fact that we applied for something and designed it to expire so quickly? And again, if you don't have this information at your fingertips, I'd love to know, how ours aligned up compared to what other states applied for and received from CMS.
Well, I don't know what all the other states applied for. I do know that states applied for and were granted up to 30% a rate increase for services, and many of the rate increases were extended for the length of the K waiver itself instead of expiring in 90 days.
Right. Okay. Again, anything you could sort of give us to put that into context would be helpful.
Yes, I can also share that, just across the border in New Hampshire, they made a decision to use their dollars to make direct payments to all direct care workers of $3 an hour increase for their staff. And I think that, that was a show of really good faith by their administration and appreciation of the hard work that these direct care workers are doing on our front lines.
Thank you.
Thank you very much, Jennifer. I don't see any other hands up, so I think we're going to move on. If Jeff Wallwender is, okay, good. He's ready. He has a hard stop at 1 o'clock. So thanks to Bob Fowler for being flexible. And Jeffrey, you're up.
Thank you as well, Bob. I appreciate it. My patient will appreciate it as well. Good afternoon, Chairpersons Breen and Gattine, and distinguished members of the committee. My name is Dr. Jeff Wallwender, and I'm the Executive Director, Chief Dental Officer, and a full-time practicing dentist at Community Dental, as well as a board member at Northeast Delta Dental. I want to quickly thank the entire committee for serving the state of Maine, especially at a time like this. I can't imagine it's easy, but it is much appreciated. For those of you who don't know, Community Dental is a nonprofit organization with dental centers in Portland, Biddeford, Lewiston, Rumford, Farmington, Monson, and within Riverview and Augusta. We provide oral surgery, orthodontics, root canals, and special needs sedation dentistry. As a frontline dentist, I have seen that patients with a good dental benefit are far more likely to visit the dentist and utilize preventive services as a family. Sadly, for many in Maine, oral health care is unaffordable. Community Dental is the largest Maine care dental provider in the state, and we serve a community with significant needs. With respect to our patient base, about 55% is Medicaid and 75% are living at less than 150% of the federal poverty level. We are the provider of last resort for many Mainers. The COVID-19 pandemic has impacted dentists everywhere, and nonprofit dental clinics were hit particularly hard. Unlike in other healthcare settings, a patient is unable to wear a mask while receiving services, and almost every dental procedure produces aerosols, which increase the risk of virus transmission. My typical ensemble includes an N95 mask, level 3 mask over that, surgical cap, surgical jacket, magnifiers with side shields, and a face shield. Up until yesterday, we also had to wait 15 minutes after each patient in order to allow aerosols to settle before cleaning the room and using it again. So if I were to see my usual 12 patients per day, that's a loss of about 3 hours of chair time. As a Medicaid provider, we need to focus on 100% utilization of our chairs. Otherwise, because of the reimbursement Maine Care provides, it just doesn't work. We typically need to see about 3 times the number of patients a private practitioner sees just to break even. So without changes to the Maine Care dental program, our safety net dental clinics will not survive this. Before the pandemic hit, main care reimbursement rates were insufficient to cover the costs of many procedures. And now this is even more common due to the increased cost of infection control. For example, our organization in 2016, 17, 18 operated significantly in the red. We now have a senior management team of 3, and I'm one of them, and I practice dentistry full time. We no longer have even a single manager at any of our 7 offices. We really don't have any other areas to trim expense. We're trying incredibly hard to be responsible and do everything to the max, but it's kind of hitting a breaking point. So Maine must really seize the opportunity to support the Medicaid dental provider network in our state. As a Northeast Delta Dental board member, I've really learned the most valuable asset for a successful dental program is its provider network. If you lose the network, it is extremely difficult and expensive to rebuild it. The cost to build a clinic with 12 dental chairs is $1.3 to $1.6 million alone, and that doesn't include annual operating costs. Maine can support its low-income dental provider network more cost-effectively in 2 ways. The first is a modest increase in Maine Care dental reimbursement rates, even temporarily, as this will support existing Maine Care dental providers in the state. I've done a detailed comparison between the cost to provide services in our clinic versus the reimbursement, and I've also compared the rates of reimbursement for every dental code to a variety of other sources, including Vermont, Massachusetts, undergraduate dental student fees, our sliding scale, dental insurances, and even compared to other Medicaid, some of our fees reimburse at about 30% of another state's Medicaid right near us, which is troublesome for maintaining our business. And I would be happy to provide any of these to the committee if they needed it. Second, I really think Maine needs to finally implement a preventive and comprehensive dental benefit for adults. This is critical in addressing the unmet oral health needs of Maine Care adults in our state. It will increase the employability of individuals as we get our economy back to work. And most importantly, it will keep patients out of the emergency room hospitals as we continue to battle this public health crisis. Second, it will allow for much needed revenue for providers already treating Maine Care adults without a reliable funding source. It is an unsustainable business model to continue to provide only emergency care without funding the prevention. The dental business model just isn't meant for emergency care only. Additionally, by adding an adult Maine Care benefit, private practice dentists would be incentivized to join the network to support their own practices during a time when individuals may lose their jobs and commercial dental insurance. For the pandemic, we have been largely open at almost all of our centers, seeing emergencies only. We would call the hospitals every day saying, if you have a patient who has a dental problem, don't let them be seen at the hospital, avoid congregating at the hospital, send them over to us. Some of our projections for continuing onward is the dental industry will never be the same after this. I'm quite certain of that. Some projections are 50% of what our revenue would be going forward. I personally think it'll be a little higher, and I'm maybe being optimistic, but I'm hoping 70%. But we already were not quite break even before, and I'm really very concerned about what will happen going forward and leading to clinic closures and things like that. So, as the executive director at one of the largest Medicaid and uninsured dental clinics in Maine, I really urge you to consider supporting the Maine Care Dental Network. I think the failure to do so would cost the state significantly more in the long run, but will also result in the continuing suffering of Mainers. I really appreciate everyone's time. I'm honored to be here and presenting. So I would be happy to answer any questions to the best of my ability.
Thank you very much, Dr. Wallawender. We appreciate it. Any questions from the committee for Dr. Wallawender or Community Dental? Okay. I think we're all set. Thank you so much. Next, we're going to go to Bob Fowler of Milestone Recovery. Bob's one of the people who let a few other people jump ahead of him, so I want to thank him for that and give you the floor.
Oh, my pleasure. I know it's a busy day and a lot on everybody's plates, and I appreciate the opportunity to speak. Senator Breen, Representative Gatine, and members of the committee, I do appreciate this opportunity. My name is Bob Fowler. I'm the executive director at Milestone Recovery. We're a nonprofit organization based in Portland and Old Orchard Beach, and our services extend to people experiencing substance use disorders and homelessness. Our services include an inpatient medical detox program, a residential treatment program, homeless outreach, recovery housing, and we also operate a specialty homeless shelter for people with substance use disorders. And today I'm speaking in my role as the director at Milestone, but also as the chair of the Substance Use Disorders Committee from the Alliance for Addiction and Mental Health Services. So in that context, we speak with substance use agencies across the state. The first thing I think I'd like to point out is just the tremendous variation of substance use services that exist. They range from congregate care settings, such as detox programs, such as the one that Milestone operates, residential treatment programs, to outpatient programs of a variety of different types. The impacts of COVID have had differential impacts on those different kinds of services, and with some being impacted more significantly than others. I think it's important to make just a couple points of where we were coming into the crisis with COVID. For one, I think many of you probably know that the report, the data that was coming out right as we were coming into this crisis was showing that Maine had taken a step backwards related to the opioid epidemic, showing a 7% spike in overdose deaths last year versus the year before. And we're experiencing, and a number of our partners are reporting, significant increases of use of stimulants, methamphetamine, cocaine, and all of that. So that's on top of the opioid and fentanyl crisis we were already experiencing. The second point that I'd make is that, and others have made this point as well, that the community behavioral health system was really quite threadbare going into this crisis. It was really challenging to keep the programs operating and staffed, and that's only become more challenging given this crisis. And then the third point that I would make is that with changes in notions, societal notions around juvenile justice and the appropriate use of police departments to solve social issues, I think it's going to be increasingly important to have an intact social service system, community behavioral health system to serve the citizens of Maine. Specific to substance use disorders, I am concerned about the outsized impact that this crisis will have on people who experience substance use disorders, which by its very nature is an isolating disease. And it's only made worse by things like social distancing and stay-at-home orders. There are a lot of services that remain closed through the system, who've had to suspend operations. Our inpatient detox program was one of those programs that suspended operations at the end of March as we lost staff due to COVID. And we've been working hard and struggling to get staffing in place to be able to reopen that program. We're hoping to be in a position to be able to do that early next month. But the absence of having those resources available to people who need those services is adding a tremendous challenge to people who are unable to access needed services. Residential programs across the state some have suspended operations, but many have had to reduce their capacity, reduce the number of people that they're able to serve. And so for organizations, that obviously has an impact on revenue. But then in terms of just meeting the needs of the community, it has an impact on reduced availability of service where it was already inadequate coming in to this crisis. One saving grace that has been mentioned by other speakers here has been telehealth. And while Milestone doesn't provide that service, we hear from a lot of our partners who are, and it's making a tremendous difference for individuals who are unable to get to the office for, logistical reasons, stigma reasons. So I think preserving that as a resource, I think will be really just very important going forward. I think it's one of the kind of silver linings, if there is one. So the community behavioral health system was really really kind of standing on a knife's edge coming into this crisis. And so it's going to be just more important than ever that we stand it up so that it's available as we're kind of coming and seeing more people seeking services as they're kind of leaving homes and engaging back into services. The specific, I'll join a couple of my colleagues in two particular recommendations having to do with this COVID relief fund for community behavioral health organizations. One specific to the current period as agencies are coming to the ends of their fiscal years. Because of the tremendous variation in the types of services means that a lot of different organizations and agencies and programs have different impacts, and some are going to be in better shape than others. But I think that'll all become clearer as we come to the end of this month, the end of the fiscal year for many organizations. So having a round of funding, which we estimated at about $15 million available to providers to make them whole coming out of this fiscal year would be part of that recommendation. The second part of the recommendation is an additional allocation of estimate of about $20 million to be available to providers on an as needed basis as we head into this next year with all its uncertainties and clearly will be needs that I won't bother to articulate here because others have in terms of PPE costs, hazard pay costs, retrofitting buildings, all that sort of thing. I recognize that there are tremendous demands on the funds that are available, but I'll just make the point that having an intact behavioral health system, the community behavioral health system, I think really is going to be just absolutely critical. And so I do hope that that is prioritized in your deliberations. And I thank you for your attention.
Thank you very much, Bob. I really appreciate your very thorough take on it. Any questions for Mr. Fowler? Not seeing any hands up. So I think we will say thank you very much. And have you submitted your remarks in writing yet?
I'm happy to do so.
Yeah, if you could send them to Maureen Dawson.
I will.
Our analyst, that would be great.
Yes, thank you.
Okay, thank you so much.
Thank you.
Okay, next we have three more folks to hear from who are up. The next one is Jess Maurer from the Maine Council on Aging. Thank you for waiting, Jess. Good to see you.
Oh, no worries. Thanks for having me. So, sorry about that. Senator Breen, Representative Katine, members of the Joint Standing Committee on Appropriations and Financial Affairs. My name is Jess Maurer. I'm the Executive Director of the Maine Council on Aging. We're a broad multidisciplinary network of more than 100 organizations, businesses, municipalities, and older community members who are working together to make sure we can all live healthy, engaged, and secure lives in our homes and communities as we age. I appreciate this opportunity to share our collective thoughts on the challenges older Mainers and the providers who serve them have faced during the COVID-19 outbreak, and also to share some thoughts on how the state could use some of the coronavirus relief funds to address some serious issues we've identified. As you know, COVID-19 is not actually an equal opportunity virus. While everybody can get it, it most likely will claim the life of those who have compromised immune systems, underlying health conditions, and chronic conditions. While older Mainers are generally a healthy and hardy lot, as we know, age can bring with it chronic conditions and other health challenges that can make some older people more vulnerable to serious illness and death if they contract the virus. And we've certainly seen that. Nationally, 80% of the people who have died from the virus are 60 and older, and people in nursing homes and assisted living facilities have been particularly impacted, mostly because these facilities house people who are already vulnerable due to health conditions, and they have staff that are coming in and out of rooms multiple times a day to provide care, often without adequate protection to prevent spread. Nationally, 42% of all COVID-19 deaths have occurred in nursing facilities. In Maine, it's over 50%. Because of this, I will underscore at the outset that it is a priority that we address a multitude of challenges facing these facilities immediately and certainly before the next wave. As the situation started to unfold in Maine, many older Mainers with health challenges stepped away from their normal activities, including acting as essential workers and also essential volunteers delivering Meals on Wheels, participating in home repair programs. Again, many who were concerned about their health began to self-isolate and to find other ways to gain access to the support services and socialization that they needed. For those older Mainers who needed care, the situation became complex pretty quickly. We saw an immediate drop in numbers of older people who are willing to accept help in their homes, including from the Homemaker program, consumer-directed program, and home care programs. The concern was that workers would not have adequate PPE, and indeed they didn't. Immediately, really starting March 16th, the Maine Council on Aging began hosting weekly calls for our members, partners, and state federal leaders, drawing between 60 and 100 people each week from multiple sectors, including law enforcement and municipal leaders. These calls gave us the opportunity to really understand what the challenges across settings and provider types were, and to talk about how we could create some shared solutions. Like everyone else, the biggest challenges early on were moving staff from office to home, getting good information, gaining access to PPE and testing, but other issues hit these providers particularly hard almost immediately. Specifically, direct care workers who couldn't find childcare had to take a leave of absence, and other older workers with chronic conditions or taking care of older family members at home also needed to step away. Most aging services volunteers are older, and many of them step back, causing the area agencies on aging in particular to have significant challenges early on in getting volunteers to deliver meals. And I'll say in one area agency on aging lost 57 volunteers in 1 week early in March. So that was sort of the magnitude of this challenge. When we started seeing outbreaks in nursing facilities, we certainly saw significant challenges with finding replacement workers and certainly in containing spread. I want to emphasize that the news is not all bad. As the federal and state governments responded with increased funding, PPE, and flexibility in the provision of services, some of these issues did begin to resolve. For instance, many people began accepting workers back into their homes once they did gain access to PPE. Also, flexibility and increased funding allowed the area agencies on aging to offer home delivered meals to people who were sheltering in place and needed to access meals, even if they didn't qualify for the program. Changes in telehealth, as you've already heard, allowed older people to gain access to much needed medical attention. And correspondingly, and I want to emphasize this, lots of older people got online for the first time. Younger unemployed people, a problem that we'd identified before the COVID outbreak. How do we get younger people to become volunteers? When they became unemployed, stepped up and became our new volunteer workforce. In addition, as I know many of you know because you've participated in these situations, communities across Maine came together to provide services like grocery shopping and friendly calling programs, which have been really helpful for older people who are sheltering in place. Our weekly multi-sector calls have continued, and 4 full months into the crisis, we're able to understand the critical structural issues we need to address in order to ensure older people can continue to access supports and services they need as our economy reopens. But as we know, many older adults will continue to shelter in place. We also need to prepare for the second wave. For these reasons, we urge state leaders to consider prioritized funding to address these following issues. Direct care workforce. As you all know all too well, we were struggling already with a severe and significant direct care workforce shortage before the outbreak. And the outbreak, as you've already heard, has exacerbated an otherwise bad situation. The truth of the matter is that even with the rate increases across all sorts of settings, providers across the continuum cannot pay workers more than they're earning on unemployment. Thus, finding new workers and replacement workers has become increasingly impossible. To address these challenges, we would urge you to consider, and I think you've already heard some of this, that Maine should take the example of other states and use the coronavirus relief funds to increase pay for frontline direct care workers, whether across the continuum. So that's whether they're in the homemaker program, home care, in facilities, and also IDD workers, as Jennifer was just talking about. As an example, the state of New Hampshire has used federal funds to establish a healthcare system relief fund that provides increased funding for workers across the continuum of care. We have to do something to incentivize unemployed people joining this workforce and increasing the ability of providers across the continuum to pay a premium rate for workers as a critical component to ensuring these providers survive through this pandemic. I will also say that initially, Maine Care increased rates for nursing homes and assisted living facilities to help them pay for necessary costs related to COVID-19. Although we're still in the midst of the pandemic, the rates have discontinued after the first 3 months. All of these facilities continue to experience higher than normal costs, and those with outbreaks are under extreme financial pressure related to replacement workers and extra staff. We urge the state to restore rate increases or develop other means of getting financial resources to these facilities. Specifically in relation to the homemaker program, which is a state-funded program that is completely dependent on high volume direct service units to generate sufficient revenue to cover the costs of direct care workers, assessments, and case management services. Under COVID, these delivery units went down considerably for all the reasons I've mentioned before, and the ISS Homemaker program has not received any federal funding or CARES Act funding. The agency Catholic Charities that runs this program did receive a PPP loan, and so was able to pay a 3-hour premium hazard duty pay to essential frontline workers who are working in the Homemaker program. But the PPP ran out after 8 weeks. So we would urge that some CARES Act funds be used to address this revenue shortfall for this program. As you all know, this is the first safety net program. It is the lowest cost, highest value program we have in the long-term supports and services continuum. And funds should be used to really prop up this program, allow them to continue premium pay for these workers, purchase PPE, and also purchase technology to support assessments. Another thing that we would be able to do to attract workers to these jobs is to quickly set up some sort of earn while you learn programs. This would shore up the community college network and get people into necessary courses and training while still on unemployment, and increase the pipeline in for new workers entering the field. Finally, in order to address to be able to address this issue longer term, we would urge the state to accelerate its rate increase work so that we can make sure that as federal money starts to dry up, we can continue to pay workers at an appropriate level. Finally, I want to talk about some other issues besides besides the direct care workers, and that would include Meals on Wheels. Last year, you all appropriated $75,000, a one-time appropriation to address a growing wait list for Meals on Wheels. Despite this funding, when COVID-19 hit in early March, a few of the area agencies on aging had reestablished wait lists, and they were growing. So additional funding through both the Families First Act and the CARES Act and flexibility in serving more people has meant that the area agencies on aging have actually more than doubled the number of people that they're normally serving. Unfortunately, while they're tracking the people who are coming on, they're finding that at least half of the new recipients that they're serving actually qualified for the service beforehand. These funds will be exhausted shortly, and the area agencies on aging as early as September or October may have to tell thousands of new recipients that the CARES Act funding has ended and that they will no longer be able to receive home delivered meals, including those who actually qualify for the program. We would urge that a portion of the relief fund go to extend the ability of people who are continuing to shelter in place be able to access home delivered meals, and also to provide for extended funding for those who qualify at least through the end of the year. I'll underscore, and you all have heard this many times before, so this is just an aside, that in addition to providing a nutritious meal for older people, it provides a safety check. And one of your colleagues, Representative Jess Fay, is one of our new Meals on Wheels volunteers, serving Meals on Wheels from Seniors Plus. And she let me know this week that when she was delivering meals, she'd found a woman on the floor who had fallen 2 days earlier and had not gotten any care until she showed up, which is one of the core services that this Meals on Wheels program provides, which is a regular safety check on our most vulnerable older folks. So we definitely encourage you to find ways to shore up that program. A couple of last thoughts. Adult day service providers are finding that as they look to reopen their programs, that the business model simply doesn't work. They are not able to bring back only a third of their normal clients with physical distancing when they're already receiving less than it costs to provide the services from Main Care. They are now thinking they may not even be able to open, some of them, before the end of the year. They have increased costs for PPE, cleaning supplies, and other materials. While they're a very small provider type, we're quite concerned that this particular provider type may fail altogether in Maine if additional funds are not made available. The area, I also want to talk briefly about technology, and you've heard a lot about that today from other folks. But the area agencies on aging, again, have been able to receive a small grant to purchase tablets and data plans and are getting them into the hands of vulnerable community dwelling older people to keep them connected. The purpose is not only to ensure they have access to telehealth services and are able to complete assessments and participate in virtual evidence-based programming and Zoom caregiver support groups, but also to address serious concerns about prolonged isolation. We're all united in the belief that we should be using some of these funds to dedicate to get technology and data plans out to older people. And as Senator Collins has urged, we also believe that some of these funds should be used to establish Wi-Fi connections in affordable senior housing projects to ensure that these lower income older adults can access the internet for socialization and care. A couple of final pieces. One is real concern for the smaller nonprofit safety net. And these are small senior centers and other small providers around the state. I know there's a big concern that small nonprofits will fail. Some of these small nonprofit safety net organizations like senior centers in Dover Foxcroft and other rural settings haven't been able to get PPP loans and have had no revenue coming in. And they're very concerned that they may not be able to resume normal operations through the year and they might just fail. And so the AAAs, the area agencies on aging, have been providing small one-time grants through their CARES Act funding to many of these organizations, but we would like to urge the consideration that additional funds be used to really shore up the small nonprofit safety net providers across the state. Of course, we also join in others in increasing testing. We also actually would urge that, like other states, testing in nursing homes and assisted living facilities be paid for by the state. Currently, nursing homes are having to cover those costs unless there is an outbreak in their nursing home. Other states are covering the cost of testing at no cost to the long-term care facilities. We would urge Maine to consider this program as well. Finally, I was listening acutely to the other presenters before me, and we certainly do join in other presenters in asking you to fund, or asking that funds be used to shore up behavioral health services, primary care services, and hospitals in particular. We are very serious concerns that older adults have significantly delayed care, and will be experiencing serious health issues as a result of that. And so are very concerned that we make sure that the health network is ready to support the health needs of older people. I appreciate the opportunity to share this information with the committee. Happy to answer any questions.
Jess, thank you very, very much. That was a lot in a lot.
That's a lot.
Short of time. We are certainly aware of the particular vulnerability of older Mainers to the pandemic, and appreciate your multi-layered approach. Thank you very much. Did you submit your comments in writing? Would you mind doing that, sending it to Maureen?
I certainly will.
Oh, it looks like Representative Jorgensen has his hand up.
Thank you very much. And thanks very much, Jess, for being here today and being with us. I'm interested, obviously the, assisted living facilities and care facilities in general are sort of a nexus of where a lot of the infections are happening. But at the same time, I think some of the ones that have been successful at avoiding infection have been like just unbelievably militant in preventing anyone from going in or out or any of those things, which I'm sure is best practice. But I guess that I'm just wondering about what the long-term effects of that kind of isolation on people are. Obviously it's one thing to spend a few months sort of in quarantine, but these folks are literally sealed in rooms and having meals brought to them. It's really hard to know. I mean, I'm not trying to advocate for lightening up on letting the illness in, but I'm also trying to figure out what is the balance you strike there. Any thoughts on that?
Yes, I mean, I have lots and lots of thoughts on all of those things, and that is the critical question. I think that that CMS, so the Centers for Medicare and Medicaid Services, are really the controller of that particular issue. They very early on issued an edict to say that essentially nursing homes and assisted facilities needed to go into lockdown because of the way we were seeing the disease spread, the virus spread in not just in this country, but in the world through nursing facilities in particular. And you're absolutely right. I mean, we know that social isolation has the same prolonged social isolation and loneliness can have the same health effects as smoking a pack of cigarettes a day. So there has to be a balance. What I will say is that I think nursing facilities, and it's a piece that I don't think we all see, have gone over and above trying to find all kinds of ways to make sure that older residents that have family members were connected to them. They've set out outside viewing, they've set them up with technology, they've created opportunities for Zoom meetings over and over again. They've put a lot of money into this, actually, their own resources to make sure that families are connecting. And I'll tell you that we're focused, I think, on these facilities because of the long-term impact. But we also have been working also since early March with Maine's congregate housing providers, resident service coordinators, and building managers. And those older folks that live in essentially what we call senior affordable housing have also been locked in their apartments and self-quarantining without any contact either, and not having any of those things happening, outside people, outside their window, talking to them and those sorts of things. It's been a real challenge. I would say providers have tried desperately to make sure that older people do have contact, and at least thankfully within facilities, there's contact with the staff on a daily basis. And I have seen so many providers doing all kinds of things. Senior centers providing, bingo by phone, anything to try to connect people during this time. So absolutely, isolation and loneliness have been top on our lists of concerns, and I do think providers have really gone over and above trying to solve those challenges. Ultimately, we're going to be looking to the CDC, the state and federal CDC and CMS on guidance on when we can let people in. They are already relaxing some of those pieces now, and I know they're trying to create opportunities for family visiting outside, create rooms within facilities for families to visit, and those sorts of things.
Thank you.
Yeah.
Any other questions for Jess? Okay. Thank you very much. Thanks for being flexible with your time. We appreciate it.
Thank you so much for giving us the opportunity.
Next, we have Mark Swan, and then we'll have Greg Payne, and then we'll be finishing up. Mr. Swan.
Good afternoon, Senator Breen, Representative Gatine, and members of the Committee on Appropriations and Financial Affairs. My name is Mark Swan. I'm the Executive Director of Preble Street, and I really appreciate the opportunity today to talk to you about the effect of COVID-19 on homelessness here in Maine, on the emergency shelters here. First, I really want to make a point of sincerely thanking our colleagues at the Maine Department of Health and Human Services, in Maine Housing, and at the University of Southern Maine. We've worked hand in hand with these public servants from these institutions day in and day out, 7 days a week, without pause, to help keep the people we serve safe and healthy. Without those state officials and state employees, none of what we've accomplished or tried to accomplish would have been possible. I think you know this, but I just wanted to say you have some very caring and very smart people working for you, working for all of us here in Maine. So I just wanted to get that out of the way. Really great people. And boy, an awful lot has happened here at Preble Street the last few months. It has been a whirlwind. First, I want to speak briefly about our anti-hunger efforts. All I probably need to say is that the demand on our food programs, on our soup kitchens and food pantries has never been higher, not even close. In April and May of 2019, a year ago, we served about 65,000 meals each of those months. This year, in April and May of 2020, we served over 100,000 meals in each of those months, an 85% increase, 100,000 meals in a month. Families, seniors, new Mainers are lining up every single day for our emergency groceries. We're also delivering several hundred meals each day to area shelters, to the Y, to several sober houses. I've never seen anything like this kind of demand in my years at Preble Street. Our food budget alone has jumped $25,000 each month. We've also instituted what we call gratitude pay. In March, we started that. It's essentially time and a half pay for all of the hardworking staff here at Preble Street who work in our essential programs, and that would be the food programs, our homeless shelters, and our Housing First programs. That's an increased cost to the agency of about $50,000 each month. And those costs obviously are continuing. And I want to talk a few minutes about the emergency shelter work that we do along with some extraordinary agencies across the state. Before the pandemic even hit here in Maine, we were in close touch with our colleagues on the West Coast, watching what they were going through, learning from them as they tried to respond. So we put out a kind of an action plan to city and state officials, calling for a really rethinking and redesigning the so-called shelter system we have in our community, and to do that immediately. And then we got to work doing it, working closely with the CDC and Maine Medical Center, as well as the city and other community providers. We basically redefined shelters into one of four categories: wellness shelters, which are for people who aren't sick with the virus; confirmed contact shelters, which are for people who the CDC has determined have been in close contact with somebody who has the virus; A third category is PUI, or persons under investigation shelters, for people who are exhibiting signs of the virus or are awaiting test results. And lastly, respite shelters for those who have tested positive and need to be isolated while they recover. So the existing shelters in this community, 2 of which run by Preble Street, also the city shelters, also the Milestone shelter, we all were reconfigured, redesigned, and kind of relabeled in one of those 4 categories. In addition to that, we really quickly ramped up and opened 3 new shelters almost immediately. The city opened up the Portland Expo, and Preble Street was asked by the state to open up a new 50-bed wellness shelter at USM. In addition to that, we were asked to manage a local hotel as a respite shelter. And I just want to say, in my time at Preble Street, we have developed and built and opened 2 emergency shelters, the Joe Chrysler Teen Shelter about 15 years ago, and the Florence House Women's Shelter about 10 years ago. Both of those efforts took several years from idea to reality. Opening a new shelter, there are an awful lot of hurdles, an awful lot of obstacles to opening new shelters, I can tell you that. But this spring, we opened 2 in a matter of days. It took about less than 2 weeks to get the shelter open at USM, and about 2 days to get the respite shelter open in the hotel. I can tell you unequivocally, it was the hardest work I've ever had the privilege to be part of. And the good news is it's worked. First and foremost, we've kept the spread of the virus among the homeless population to a minimum, thank God. And secondly, the effect on clients at the USM shelter in particular has been extraordinary. Our clients there are not only safe and healthy, but they're also healing from life on the streets. They're working with our professional social workers there to move on from homelessness. At this shelter, people have space, they have privacy, they have personal dignity, they have control over their lives, and this allows them to heal from the trauma they've been through and to start to move on from homelessness. So from this public health crisis, we've learned a lot, and we can't go back. We can't go back to crowded, cramped shelters with people sleeping on the floor on mats 10 inches apart from one another. We can't have soup kitchens overflowing with 300 to 400 people trying to get a meal, trying to feed their families. We just can't do that anymore. And I know many of you know Preble Street, we pride ourselves on being an advocacy organization as well as a social service agency. We think those 2 roles complement each other very well. And one statement we've said over and over again, probably 1,000 times over the last 30 years in our advocacy role, is this statement: shelters are not the solution. We have said that thousands of times. And then after that, we say something like permanent housing is the solution, or livable wage, or universal health care is a solution. Well, I'm going to tell you, we are no longer going to say shelters are not the solution. It has been made abundantly clear to us that they sure are a solution. Without any question, that's true. Shelters are a critical part of the underpinning of our healthcare system, our behavioral health system, our substance use disorder system, and now we've seen firsthand that these shelters are critical to the underpinnings of our public health infrastructure. In March, when this virus hit, it was the shelters who stayed open. It was the shelters who actually expanded during this time, many of them just as I described Preble Street did. Most shelters across the state are small, local efforts of amazing people doing so much with so few resources and with very, very little state funding. And they, like Preble Street, were asked to do more over and over again. They were asked from their towns, from their cities, sometimes from the state, from local hospitals, and of course they were asked by poor people themselves showing up, looking for safety, looking for sanctuary from the virus. I'll tell you, the shelters across Maine have been talking regularly during this pandemic. We've been learning from each other, sharing resources, sharing ideas, also leaning on each other as the stress and strain has taken its toll on the staff and on the organizations. This has been a very, very challenging time for shelters, but they stayed open. They've patched together resources, they've begged their staff to stick with them, and they've responded over and over again. And I want to say, as this was happening, it was kind of tough to see other providers closing their doors for a day, for a week, for a month, or working remotely, or offering up alternative approaches to care like telehealth and other creative ideas. And I'm not trying to denigrate those agencies or those approaches. I know, like all of us, there's no playbook for this, and everybody's doing the best they can. And I have no doubt at all, they were still able to help people in that manner. But they had the option of closing. They had the option of working remotely. Shelters can't do that. We can't close. We can't do telehealth. We can't work remotely. We are the last line of defense for poor people. And as I said earlier, this recent shelter expansion that we did and are still doing, we could not have done it without great help and resources and support from the state. That is undeniably true, that they were with us every step of the way. And I guess in a nutshell, if I had to try to capture this very, very succinctly, I would say that's why I'm here today, to ask you to stick with us. We need that kind of commitment from the state to continue, that kind of partnership to carry forward, that kind of real understanding that shelters are a vital component of a healthy and sustainable health and human service system in this state. So I urge this committee and the legislature as a whole to take this effort on. Please don't just thank us for our hard work and then go back to the way things were, taking us for granted, taking shelters for granted. We need sustained state support to do this work. And I can assure you, we are not going back to the way things were. But we need to stop scrambling to piece together makeshift shelters across the state, relying on these small agencies with little or no state funding to move mountains in the midst of the next public health crisis or natural disaster or devastating economic crisis. As a way to guide that effort, I urge you to consider the proposal that was submitted in May to the governor, to the Maine Housing, and to the Policy Innovation Council for CARES Act funding. And if you don't have that, I will forward that along with my remarks today. This proposal, it was put together by the very same hardworking people and organizations that are doing the shelter work I described. It was submitted by the Maine State Homeless Council, the Maine Shelter Network, and the Continuum of Care in this state. And in that proposal, you'll see well thought out plans and recommendations regarding affordable housing development, supportive housing efforts, the expansion of the successful rapid rehousing model that we know works, and strengthening and redesigning the shelter services that I've been talking about today. So I ask you to look at that proposal and also to talk with the shelters in your areas, in your districts, and to help us dramatically improve these life-saving services. Thank you so much for the time today, and I'm happy to answer any questions if you have any.
Thank you very much, Mark. I know I'm in receipt of the housing proposal that you just referenced, but if you could send along your comments, that would be great as well. Send them to Maureen. Any questions for Mr. Swan, Preble Street? Representative Gattin.
Yeah, I'm going to say something, Mark, and that applies to you and also a number of the other people who came today. I just hope that you will pass along, the gratitude that a lot of us feel for your staff and your volunteers. And, people have stepped up in some very, very remarkable ways. And I can't imagine, what it's like for the folks who work at Preble Street. And again, this goes to some of the people who support some of the other efforts we heard about this morning, but, trying to serve people in this very difficult situation where it's difficult to do it safely. You're trying to keep your own family safe, in the meantime. And I think you're making some extraordinary personal sacrifices, all, to advance the mission. And, I have a very warm spot in my heart for the people of Preble Street, and that includes obviously all the people and volunteers that work there. So thank you very much.
Thank you.
Looks like Representative Keschel has his hand up.
Yes, thank you. And I echo those comments by the good Representative Gatine. I do have one question though, and it's been something that I've wondered about since COVID started as it pertains to the homeless population. Do you have any knowledge or information about the numbers, either percentage or actual numbers of homeless who may have been infected with COVID-19, and whether or not, how many of those survived or not?
Yeah, I can at least partially answer that question. At the local level, we've seen fewer than 15 positive cases in the last, since it hit Maine, and thankfully no critical cases. Everybody either has or is recovering. That's in that I would say that's in the greater Portland area. I know in other parts of Maine, I know in Bangor, there was an outbreak. And I know of a handful of cases in the Lewiston area because they came to our respite shelter in the Portland area. I feel pretty certain I can say that there's been no casualties. Nobody has died from the virus from this population. And I do think, with the exception maybe of that hotspot in Bangor, I don't think we've seen a dramatic outbreak. Thank God.
Thank you.
Any other questions? Yes, Representative Jorgensen.
Thanks very much. I really appreciate your comments as well. I've appreciated Bob's earlier. And I just wanted to ask about, you were talking about the Sullivan Gym facility and the success you've had there with people, getting them connected up with services and getting them on a path to getting into something more stable. It sounds to me like you're describing a housing first model, which is sort of, that's sort of the same thing that we've seen has happened there. And at least that's what I've learned through my work with you over the years. What do you see happening once the Sullivan Gym turns back into a gym? How are you going to get those folks into some kind of a, what is the plan? Because you talked about this very positively, and I'm just interested in knowing how that's anticipated to go.
It's a plan that's being figured out as we go, Senator Jorgensen. I can tell you a couple things, though. There will be there's going to be a transition out of the USM gym in about a month, because we have a deadline to move out of there. And we're in conversations with the city of Portland about a midterm transition plan for the 50 people there. What we are hoping to do and planning on doing is repurposing one of our facilities into a new 40-bed, 24/7 wellness shelter, with the goal and hope that we can have that up by this fall. So it's a building we own. It's zoned as a shelter. It has been used the last 12 years as an overflow shelter by the city. So we think there's precedent there, and it's a good location and a good facility, and it's kind of shovel ready, if you will. So our goal would be by the time we hit the fall, we can have a new shelter up and running here in Portland. I think that's a first step. I don't think that's the only step. We need more smaller, spread out, spaced out, 24/7, professionally run homeless shelters. We really do. In addition to that, I'm so glad you mentioned Housing First. In addition to that, we certainly want to keep that momentum going as well. The Housing First work is an incredible model that we know is successful for a lot of people. So we don't look at it as an either or. We're pushing forward on both fronts for sure.
Can I ask one more question?
Of course.
Madam Chair?
Sure.
Okay. The question I wanted to know too is I'm just astonished by the number of meals that you're serving and the new ways you're delivering those. You're getting them actually out of the kitchen in 2 different facilities around that maybe people would otherwise have come to you at the kitchen or something. Is that something I mean, I'm just interested in thinking about that as a different model in terms of maybe helping to solve some of the problems that the city has experienced with, people really clustered together. Obviously, you can't do that anyway, just for health reasons right now. But is this a new sort of paradigm, do you think, in terms of how you deliver food and get that out there?
Absolutely. When the virus first hit, we went to, we pivoted quickly like everybody has been doing, and we went to a to-go model rather than having 300 or 400 people crowded in 3 times a day. As you say, it was very crowded. It was our primary soup kitchen was meant for 100 to 150 people, and we were seeing 300 to 400 people all the time, every meal. So we have gone to that all to-go model, and we're going to continue with that. We're actually ramping up our food production capacity and looking at getting more vehicles to deliver food, as well as doing a really strong outreach model, working with Milestone and other organizations that have a street presence. And to do exactly what you just described, we no longer want to have hundreds of people coming together. That's clearly not a public health not a smart public health thing to do. And we know from the Housing First work, from our Florence House shelter, from our teen shelter, there was a city task force 5 years ago. HUD best practices call for it. Smaller shelters, more spread out. We have professional social work staff working there, not paraprofessionals, not volunteers. We need to treat these shelters as, sustainable, smart, best practice parts of the human service system. And that is different. Most homeless shelters in this country grew organically in the last 30 or 40 years in church basements by activists and volunteers and the faith community, and they've done wonderful work. But they need to go to a new level. And we're doing that with our shelters. And I'm glad you asked, because we're absolutely doing that with our food programs. We're not giving up on our food programs. We're actually expanding them, but doing it in a better way, a smarter way, bringing meals to where people are staying, where they're living, where they're sleeping. Shelters aren't going to be sending people to our soup kitchen anymore. It's the other way around.
Thank you.
Any other questions for Mark Swan or Purple Street? Don't see any. Thank you so much. It's going to be a hot weekend, so I wish you luck. Hope everybody stays cool.
Thank you.
And thank you for waiting too, Mark. Our last person who's going to talk on a related topic is Greg Payne from the Maine Housing Coalition. Greg, the floor is yours.
Thank you, Senator Breen and Representative Gatine and the distinguished members of the Appropriations Committee. My name is Greg Payne. I'm the director of the Maine Affordable Housing Coalition. It is very nice to see you all, and I really appreciate the opportunity to just spend a few minutes talking a little bit about what's happening in our rental markets, the rental housing markets right now. There's kind of 2 overarching points I think I'd like to make. One is fairly upbeat, the other is not. I'll start with the upbeat one, which is that people have been paying their rent at a much higher rate than I think any of us expected when all this started. And we realized the kind of challenges people were going to have with the loss of earned income and keeping up with their rents. Generally, I think both for affordable properties and for market properties, rent collection is about on pace with norm, maybe a percentage point or 2 off. But I think, again, people expected a lot worse than that. And that's very good news because renters don't seem to be falling behind on their rent. That means landlords are able to keep up with their bills as well, pay their own mortgages. That's great. 211 data generally shows that there was a very large spike in requests for rental assistance between mid-March in mid-April, and then that settled way down, perhaps as resources became available and stimulus checks went out and unemployment benefits became a reality, and the Maine Housing Rent Relief Program was stood up. So those have settled down nicely. The more difficult part here is, as we dig deeper and we talk with lower income renters to understand what's going on. It's sort of like you're paying your rent. That's great. That's very good news. The question is how, and is paying your rent creating problems in other areas? And what do you think about the coming months? How are you feeling? What's your anxiety level about your ability to keep that up? As we talk with those tenants, I think the broad picture that we're getting is that people are generally cobbling together a wide array of sources. Like, there is still some earned income, just not as much before. There's small amounts of savings that people have been burning through. A lot of people are receiving the enhanced UI benefits, and those have been really helpful. The stimulus checks were helpful. The Maine Housing Rent Relief Program, again, has helped a lot of people. So people are cobbling it together like that. They are also making it very clear that they're skipping other bills because they're so concerned about what it would mean if they were to lose their housing right now in particular. So I think it's as we go from where we are now to the next chapter of this, and as the summer unfolds, and especially as we get towards August, that stimulus checks will have been used. UI benefits, as you know, end next month, the enhanced benefits. The Maine Housing Rent Relief Program, again, it's a one-time benefit, and my sense is that that's pretty well fully subscribed at this point. There are, these savings are running out. The labor market remains sluggish. Folks aren't expecting that they're going to have their full hours back. There are eviction protections in the CARES Act that are coming off in late July. Maine is going to start scheduling eviction cases again in early August. And so all these things are sort of happening at the same time. And there is a great deal of stress and anxiety among renters that we're talking to about navigating that next step. There is a modest amount of CARES Act money that went to the CDBG jurisdictions, including DECD. And the expectation is that starting in July, there will be some modest amount of rental assistance available for people in most of Maine, which is great news. And that can maybe help take some of the pressure off of Maine Housing's program. But I think the concern is that that is a pretty limited resource. It is going to get spent down probably very quickly. And so we're just very concerned that by the time August comes around, there is going to be this very significant need for additional rental assistance resources. And we're not sure at this point where that's going to come from. Of course, if that does happen, we risk this large spike in evictions at a time when obviously we want to keep people as safely housed as possible. And again, when people don't pay their rent, there is a domino effect with owners and landlords who have their own bills to pay and their own taxes to pay and their staff to pay. And so obviously we want to do all we can to prevent that from happening. Last thing I'll say is, I'm sure you all are getting all sorts of feedback on ways that you could use the Coronavirus Relief Fund. I will say many states are in the same boat that Maine is in having a lot of concern for what happens towards the end of this summer. And they are setting aside funds from that Coronavirus Relief Fund to deal with this and to create a new resource for rental assistance. New Hampshire has allocated $35 million from theirs. Vermont has allocated $50 million from theirs. Montana has allocated $50 million from theirs. Other states are obviously Maine is not unique in the concerns and the need for some stability in the rental housing market. And so we would highly recommend that Maine consider doing something similar as you consider all the various needs and uses of the Coronavirus Relief Fund. I will stop there. I'm happy to answer any questions you might have, or if folks have questions about the housing development pipeline or other housing dollars in the CARES Act. But I will say generally, The governor's office has been extremely dialed in on this issue, and that's been wonderful. So has Maine Housing, so has DECD. And frankly, so have landlords on both the market and affordable side. There's been a lot of conversation going on. The communication is wide open, and that's been a great thing. But I will stop there, and I'm happy to answer any questions if I
Greg, before we go to questions, I just want to ask you to submit your comments to Maureen so we can have those in writing.
Absolutely.
Representative Gatine has a question.
Yeah, Greg, thank you for the presentation. And again, I think combined with Mark Swan's presentation, it gave us a good little, I think it was good to have those positioned like that. But you just referenced, I'd love to hear just a little bit like, on the development side, and any impacts from COVID on that, or projects moving forward, pretty much as planned.
Yeah, I'd say right now there's kind of two stories. And again, it's one's pretty positive and another is very concerning. Projects that were under construction when all this happened are doing okay. And again, I think that's surprising and relieving for a lot of us. We expected supply chain issues. We expected, construction to have to stop as subs, we're concerned about safety, subcontractors. That's not happened. I mean, there have been some small delays, but I would characterize them as quite small. So projects that were already under construction when COVID hit and when, in mid-March in Maine, those have been doing okay. I think the greater concern is with that set of projects that are in the pipeline, that people are working on now, have not reached a construction loan closing, rely on an investor market that is very much in flux right now. I mean, you all know, because you've done so much work around the low-income housing tax credit. That is a program that drives almost all affordable housing production in Maine and across the country. And it is an investor program. And right now, investors don't know what they want to do. And that is right now causing, the pricing for tax credits to go significantly down. The low-income housing tax credit itself is tied to federal borrowing rates. So the 4% federal low-income housing tax credit, as we like to refer to it, is actually now a 3% credit because of what's happening with interest rates. So again, big picture, projects under construction are good. Delays are not nearly as bad as we expected. But the projects that we were hoping to break ground on later this summer and beyond that have been in the pipeline, those appear to be at some risk right now. And that's a major concern for us, that we are focusing some of our federal advocacy on to address some of those tax credit issues.
Thank you. That was exactly what I wanted. Thank you.
Any other questions from committee members for Mr. Payne? All right. Well, thank you very much. And we look forward to getting your remarks in written form. And I think this draws our formal presentation and most of our meeting to a close. I just want to remind folks who are here to fill out your timesheets and make sure you get them signed by the two chairs. We might be meeting next Friday, or we haven't quite figured that out yet, but we're interested in hearing from another sort of cluster of folks. So any comments or questions from any committee members before we sign off, or from our analyst? Any closing remarks, Mr. Co-Chair?
No, again, want to thank everybody who showed up today. Again, it was a long day. As always, I guess we should expect it took us a bit longer than we thought it was going to be. Want to thank you, Senator Breen, for handling with a lot of grace and patience some of the technical difficulties we had getting kicked off. I very much appreciate you doing that for us today. Thank you.
And thanks to the IT folks for
Always.
all of your help.
Yep.
Yes. All right, everyone. Happy Father's Day out there, and we'll be back. Thank you.